Dean of the school, and my happy pleasure to welcome you today to the inaugural Johns Hopkins-Pulitzer Center Symposium. And it's great to see so many people from our school community here, but so many people who are connected to us in so many ways, alums and friends. So our collaboration with Pulitzer Center on crisis reporting began last spring, although we were talking long before then. And what we found is that we're natural partners because we both care deeply about advancing the human condition by sharing knowledge. So in addition to this annual symposium, we also collaborate each summer to sponsor a Bloomberg School student to research and report on a significant global health story. Our first Hopkins-Pulitzer Fellow, Varsha Ramakrishnan, documented the harrowing issue of dowry violence in India. And I encourage you to read the article. It's incredibly moving. It's I think one of the best articles we ever published. The new issue of the magazine is outside, and you can read it there. It's just an incredible piece of work. So that's a great way to get this partnership off to a great start, and I know that this symposium is going to do the same. I want to give a special welcome to John Sawyer, Peter Sawyer, and Ann Peters from the Pulitzer Center. Today we're going to talk about an issue that clearly draws on the expertise of both our organizations, non-communicable diseases and the media. Most of us know that chronic diseases represent one of the greatest threats of human health in our era. In 2005, over half the deaths that occur around the world are caused by chronic diseases. And it's true in almost every country. We're going to hear more about this global challenge in a moment. But it's especially frustrating to us in public health that many of these diseases are preventable. And as you all know, important causal factors for non-communicable diseases include tobacco use, unhealthy diet, physical inactivity, and the harmful use of alcohol. Working against our public health mission of prevention are some really powerful interests, including, but not limited to, major tobacco companies, international food conglomerates, and alcohol companies. And there are similar powerful interests that mitigate our message of the importance of physical activity. International companies pour incredible amounts into advertising and saturate the media with their messages. One single company's budget for marketing is twice as large as the entire WHO budget. That's a powerful snapshot of the challenge that we face in getting our message of prevention out there. But we have some strengths. We have in our corner experts, evidence, and the media. Despite the tumultuous last decade or so, there are still many, and I mean tumultuous in many ways, but I'm especially talking about the change in media companies. There are still many journalists committed to telling important, underreported stories of global health. So what's the media's role in addressing the epidemic of chronic disease? How should all of us in public health engage with the media to meet these challenges? How can we influence corporations to make healthy lifestyles easier for people? These are the questions that our experts are going to be grappling with today, and we have some outstanding speakers for you. In addition to John Sawyer, you'll be hearing from my favorite radio reporter, Joanne Silberner, and when I talk about being connected to Hopkins, I'm happy to say that Joanne's husband is Howie Frumkin, who's my colleague and dean at the University of Washington School of Public Health, so she has a strong connection to us. And then former Time reporter and WHO communication advisor Dick Thompson, and lastly, legal expert Ben McGrady. I'd also like to introduce a trio of our outstanding faculty, Bob Lawrence, Joanna Cohen, and David Jernigan, who many of you know. I'd also like to welcome two amazing alumni who have returned to the school today to share their vast expertise. First, we welcome Francisco Becerra, right here, Assistant Director of the Pan American Health Organization. He's a 1984 alumnus of the school, graduated from our MPH program, and he brought, in a very pleasant surprise, brought with him Carlos Santos Burgoa here, who is also an alum of the school and who was a student with me, and we knew each other well back then. And then lastly, another co-student of mine, Derek Yak. Derek and I were MPH students together in the mid-'80s, and he's had a number of illustrious positions in his career, and now is Senior Vice President of the Vitality Group. So a special thanks to everybody who's here today to participate in the symposium, and all of you for coming and participating. So thanks very much.
Thank you, Mike. I'm John Sawyer with the Pulitzer Center on Crisis Reporting, and it's a great pleasure to be here with all of you today, and thank you all for coming out. We're thrilled at the Pulitzer Center to collaborate with Bloomberg, the Bloomberg School, to explore the critical challenges of non-communicable diseases, and especially how the role of the media in raising public awareness and creating engagement on these critically important issues. As Mike has just outline, we've got an amazing array of speakers today and a lot of expertise, and I'm looking forward to hearing them all. I believe that the journalism field and the public health community both can benefit a lot from the issues we're talking about today and the ways that we can help each other to convey these truths more effectively. I'm going to say a bit more about the Pulitzer Center later, but first I wanted to start today's proceedings by introducing Francis Becerra, who will outline the health challenge that we're gathered here to discuss. As Mike just said, Dr. Becerra, in addition to having Bloomberg ties, is the Assistant Director of the Pan American Health Organization and is responsible for the supervision of programs that provide technical cooperation to each of the 35 member countries and territories. Dr. Becerra has a doctorate in public health from the National Institute of Public Health in Mexico, an MPH from here, of course, and a medical degree from the National University of Mexico. He has over 30 years of experience in public health and in the field of health research and development. He's also new to this job. He was just appointed in late September. So we think it's a perfect beginning for this symposium to have Dr. Becerra lay out, give us an overview of the issues. And as you've heard, we've got a lot of ground to cover today, so we're going to try to be as disciplined as we can in terms of time, and most of the presentations will be 10 minutes except when we say, and Peter, my colleague, is here in the front row to flag us down if we run over. So with that, let me introduce Dr. Becerra. Thank you.
Good afternoon, everybody. It's nice to come back home. I was home for 1 year for the master's back then, and I was briefly here last year, but it's amazing to see the changes the school have had in these 30 years. And 30 years, exactly, more or less, I was starting my master's here. So it's good to be here. And I bring you warm greetings from Dr. Clarissa Tien, our newly appointed director of the Pan American Health Organization. She's from Dominica, and she took position of the directorship last February. As John said, I just assumed on the 26th of September the position of assistant director, so I'm pretty much new to the position. And I'm happy that I joined a very a nice, recognized organization with a great team of professional staff that we have there. So may I have the first one? Which one is? Okay, great, thank you. So I thank you, Dean Clark, for hosting this event, and for John for inviting us. But I'm going to start facing the facts around what's happening in the American with the disease burden around non-communicable diseases. There's about almost 4 million deaths occurring in the Americas due to NCDs. So you can see the graph here, how cardiovascular diseases, chronic respiratory, other NCDs, diabetes, and cancer are the main causes of deaths. So we're talking about 200 million people living with an NCD in the Americas. So you can imagine not only the impact on deaths, but also the impact that these people living with NCDs is having in terms of economical impact. And from this, the amount of smokers with elevated blood pressure of adults is about 30%, and 25% of persons of 15 years are obese. So this is just a quick overview of what you're facing. And not only, we have to think only on this in terms of mortality and morbidity, but the impact that economically this may have. Then the main NCD risk factors. And this is also related not only to what we do in terms of activity or diet, but here is how we can, people has access to food, high quality food. So one of the risk factors that you can see here is low fruit and vegetable intake, which is not only high blood pressure, overweight, alcohol use, smoking, high cholesterol, but also access to healthy foods. And that's something of economics and availability of food for people. Even though the trends have been going down a little bit between 2000 and 2009, you can see that for these major diseases that we have here, the trend is still very high. And for instance, in diabetes, it's almost, we stay more or less the same. It's a minus 5% reduction, a plus 5% in another, so we got even in diabetes. But you can see that the trends are not really diminishing as the problem is growing in terms of morbidity. So this is also very important to know and to state that here there's a big opportunity for public health to act and to do things. Inequity, I was saying, is also playing a major role. You can see Marshall Islands and all these countries that are low middle income countries, how the probability of death is higher in this age group than with high income countries. So once again, economy, low income countries have a burden in terms of disease, but also to access to healthy foods and to other issues. So this is important and relevant to understand how economy plays a major role in this area. So when we have a significant impact, you can see it in terms of economy, health systems, and households. And this is really the key issue when everything comes down and we can really see the impact of what's happening. So you can see from the economies what all the major things here. Of course, cost to employers is huge. Absenteeism and all the other related issues that brings absenteeism to employers. But health systems are the ones taking the greatest burden in terms of attending people and having to take care of all these things. And also at the household level, how this is impacting the household level in terms of people who get sick, doesn't bring resources to the house, they have to spend money in medication, they have to spend money on hospitalization, and all this has a huge impact again, and we come into a vicious cycle of having more economical problems at home. When we see the potential life expectancy gain in the absence of selected risk, you can see how the increase in life expectancy, when we diminish these risk factors, is huge in some areas, and here in the Americas is this. But this has a positive impact in health and in economy. So we have to be aware that whatever we can gain in these areas is important. For instance, there's the changes in the food intake in Mexico. You can see that we're diminishing in terms of fresh vegetables and fruits, even though we have a lot of them, or it's cheaper than here. But the increase in refined carbohydrates and sodas is just amazing. So how we can do, what can we do to level this is just a never-ending task that people mainly in the public health sector have to strive and focus on every day. But see what's happening in the consumption of soda in Mexico and sugary drinks. This is the United States, Peru, Colombia, Brazil, Chile, and this is Mexico. No wonder we have #1 place in obesity. So this is a huge problem, and we are facing it, and we have to do something about it. But here is a reality in terms of what's happening in terms of the soda industry, and the key argument is that a calorie is a calorie. When we know that a calorie coming from sugar behaves completely different than another calorie from another source. So sugar is toxic. But the message that we're getting in Mexico because of what's happening, there's a proposition of the president to tax sugary drinks with a 2% tax per liter. It's a 20% tax per liter, which is about 1 peso for a drink. And that has brought the industry together, saying that sodas are not harmful. That is personal responsibility to see how much you drink. But they have mobilized, and they're doing exactly the same what tobacco industry did many years ago. They're mobilizing all the sugar industry together, saying that they're going to be the ones suffering because of this taxation, and that is going to be have a huge impact on poor people, depending on the working on the whole chain of process from sugar. So that's something they're saying. When we know that only 20% of the sugar or the sugary drinks that we have in Mexico, only 20% comes from sugarcane. So marketing, as Dinke was saying, you can see how the difference of the marketing industry has and the amounts of money that the industry is pushing into marketing campaigns to really try to level down. So what we have seen in Mexico is something that mainly Coca-Cola has striving to say that you have to do more activity, that sugar drinks are okay, but never a government can counterattack that campaign. And the media has been forgetting about this issue. So this is what the media should be doing, taking all this in consideration. And that's what we need from the media to really support public health actions and try to minimize all the marketing campaigns that we have. In conclusion, the fight against NCDs is not only about individual choices. I mean, marketing is doing promotion of bad habits, of bad things to do. And we cannot, and we do not have the same amount of money for doing other actions in the health sector to prevent these issues. So the industry now, the food industry is following the steps as on tobacco. We have, the only tool that we have now in our countries, in all the governments, is regulation. And we have to work with regulation to minimize all these things that are happening. So regulations, taxation is what we have in our hands to do something. PAHO has quite a few technical publications that you can download from our website. They're available for everybody, and this is one of the things that we're working. Carlos Santos is acting director for MHH, as we call it, which is non-communicable diseases and mental health. So he has a big challenge ahead, and his department has a big challenge because this is one of the critical issues. PAHO and WHO have very strategic plans to try to do something, but schools of public health, preparing people to go to the field, have and must do something important as to try to help us in minimizing all these risks. Thank you very much.
Thank you, Francisco. Dr. Becerra has outlined the complexity of the non-communicable disease issue. It's an issue that requires action on advertising, industry, regulation, health systems reform, and most difficult, change to lifestyles. He also had a lot of tough-looking charts and graphs. And that's where we think journalism comes in. How can this challenge be explained to the public in such a way that informs progress and promotes progress? How can we hold industry accountable? How do we tell this story? let me move behind on a slide. I started the Pulitzer Center to support journalism on issues that were not covered in the mainstream media as well as we think that they should be, looking at underreported systemic issues of our times. It's a long-run approach, a focus on the big picture issues that affect us all, water and sanitation, climate change, maternal mortality, labor exploitation, and environmental degradation, all neglected perspectives on conflict and more. We do this work in partnership with the world's leading news media outlets. We cover the travel cost, and then these outlets publish the work and pay our grantees a fee, though never as much as they deserve for the work that they do. And that gets at another challenge. The Pulitzer Center notwithstanding, the resources to tell health stories are in short supply. Health journalists were among the hardest hit by cuts in the newsroom over the past decade. The field has lost many of its best reporters. Many have ended up in public relations positions or working for NGOs. And the non-communicable diseases story itself is very difficult to report in a compelling way. They move slow. They're not newsy like violent conflicts or an election or sporting events. They lack the visual richness of an environmental story. And as we just heard, they are about people who are seemingly far away and whose well-being is not clearly connected to our own. So we need more journalists who can tell these stories to the public and who can apply to us for grants to do so. And that's why partnerships like this one with the Bloomberg School are so important. It exposes students with an interest in public health to the power of journalism. We need more journalists with deep expertise on the issues that they cover. Varsha Ramakrishna's work, which Mike mentioned, and who was a fellow with us this past summer, on dowry violence is an excellent example. It was her clinical experience as a doctor in India that showed her the extent of the problem. All she needed was a little guidance to get the story to a broader audience. And as we'll hear later from Joanne Silberner, everyone in this room can do similar work. Our partnership is also important because with limited resources, we need to know the impact of the work we do. Here at Hopkins, the top public health school in the world, you are sensitive to the impact the media has on your own work. That's one of the big reasons why I'm excited about this symposium. Does journalism have an impact on health or not? Do you hear policymakers referencing news articles on health? What kinds do they reference? What do you want to see more of? What do you wish the media would not do? I now want to introduce Joanne Silberner, a two-time grantee of the Pulitzer Center who has been focusing lately on the burden of non-communicable disease in the developing world. Joanne came to us with a proposal on cancer that was supported by PRI's The World. It was the start of a great partnership which has yielded Joanne and the world a slew of prestigious journalism awards. The work also included an interactive map, which I think we have here, yes, Cancer's Global Footprint, that was developed by Dan McCary of our staff at the Pulitzer Center that shows the burden and morbidity of cancer around the world. You can visit it at globalcancermap.com, and hope you will. It's a great interactive feature. It's wonderful that we are able to have Joanne with us today to discuss just how she manages to bring these stories to life. Joanne covered health, policy, global health, and other health-related issues for NPR for 18 years. She has a bachelor's degree in biology from Johns Hopkins University, a master's in journalism from Columbia, and completed a one-year fellowship at the Harvard School of Public Health. She's now an artist in residence at the University of Washington and freelances for PRI's The World. So, Joanne.
Thank you, and it's wonderful to look out and see all your faces. I actually have another Hopkins connection in addition from having been an undergraduate here. I worked for a year in the Office of Public Affairs. So I've seen dealing with the media from both sides. In terms of today's symposium, I'm kind of at the bottom of the food chain. I'm that reporter who wants to go out and do stories on non-communicable diseases and has to figure out how to do it. And I think the plan here was to start with a story. Just click. Whoops. And do what? There we go. By the way, I have a hard time listening to my own stories, but so.
Still finds time to see patients like Mr. Satimba. How are you? Satimba is in this small room with little more than a chair and exam table.
Everything okay? Yes, I'm eating okay.
He's here for a checkup. He has a type of gastrointestinal cancer that is often fatal even in the West.
We're getting one of the best treatment for this disease.
Oh.
Yeah.
Orem has arranged for Satimba to get a very effective and costly new cancer drug for free, courtesy of the manufacturer. There's paperwork involved, and drugs for only a few cancers are available this way. It's a godsend for Satimba, who's been doing very well. Unfortunately, he's the rare exception, says Orem. The survival rate for cancer patients who make it to the Institute is astonishingly low.
In a year, we get about 22,000 new cases. And of those 22,000, 20,000 actually do die within a year.
Most Ugandans don't have a real concept of cancer as a set of diseases that can be diagnosed and treated. In some tribal languages, there is no word for cancer.
People are dying because they don't have a system. They don't have early diagnosis. They don't actually even know that they have cancer.
The people who do realize they have cancer often hide it. There's stigma and there's this.
Once you are diagnosed with cancer, they think that it's already a death sentence.
And they're partly right. Most people don't come in until the very last stages of cancer. At that point, no doctor anywhere could do much for them. Orem studied oncology in the U.S. He came back to Uganda to head this government-owned cancer institute in 2004. For several years, he was the only oncologist in the entire country.
It was really very, very demanding. But even up now, I can't explain how I was managing because actually I was doing everything.
Orem doesn't complain, ever. But some things make him cringe. One of them is a comment he's heard expressed by people from developed countries, that cancer doesn't hit poor people.
People think that, oh, malaria kills, other diseases are killing people from a low socioeconomic status. But cancer is the same. The truth of the matter is that cancer is a disease of the African person, just like any other person elsewhere in the world.
The perception that cancer is not a problem of Africans leads to lack of money, he says.
When you ask for funding for cancer, nobody is going to give you. But if you ask for funding for these other diseases, they say, all right, your priority is correct. We are going to give you some funds. I think that is actually the reason why things are the way they are.
There's also a perception that cancer is too expensive to treat, and treatment is too high-tech to be done in poor countries. Orem says that's not necessarily true. He takes me for a walk up a hill so we can see the Uganda Cancer Institute.
We just have to go up and then we look back.
Up the hill, the Ugandan government is putting up what will be a modern 200-bed cancer hospital. It will replace the 120 bare-bones beds of the Uganda Cancer Institute down below.
You see that expanse of a building with a blue roof? That is the outpatient department.
In that building is a clinic like some you might see in the U.S., where patients receive chemotherapy through intravenous lines. There's also a building with the beginnings of a modern pharmacy. None of the buildings include a gamma beam generator or a robot that can do surgery, but some conditions can be treated as successfully here as in the U.S. And now Orem has the help of 5 Ugandan cancer specialists who recently got training in Seattle at the Fred Hutchinson Cancer Research Center. What keeps Orem going is that people in the West are beginning to take interest.
I'm really happy to say that people are much more receptive to our messages than before. It looks like we are beginning to make an inroad.
Last year, the United Nations urged that more be done to detect and treat cancer in the developing world. George and Laura Bush recently toured Africa to bring attention to breast and cervical cancer. Still, Orem says, when it comes to fighting cancer, Uganda is just at the starting point. For the world, I'm Joanne Silverner, Kampala, Uganda.
I keep hearing ways to make that story better. But I think you can see what I was trying to do with that story, because there's a challenge to non-communicable diseases, and John mentioned the reporting challenges, getting people interested in something that was the same yesterday as it's going to be tomorrow. So I've tried to do a profile of this one guy who really shows some hope and gives people something to relate to. I want to expand on something that John said a little bit about journalism and what's happening to it today. I'm going to give you two numbers, both from the Pew Center for Excellence in Journalism. There are 1/3 fewer reporters today than there were in the year 2000. Ad revenues in newspapers were $46 billion in 2003, $22 billion in 2012. And do the math, that's less than half the amount of money to do these stories. And that's why I wouldn't have been able to do the story without the Pulitzer Center. You know, the money has to come from somewhere. These stories, it's tough to go out and do them. So the things are changing, but there's an awful lot that's been pulled out of a system, a media system that I don't think was doing a good job covering neglected or non-communicable diseases in the first place. So I'm going to tell you a little bit about how I did it and what I did, and I'm just one person. There's obviously a lot more, or not enough more people like me. In that about 10 years ago, I basically just started getting annoyed. I was getting annoyed about how many things the public didn't know. Neglected tropical diseases. Look, the first word in the term is neglected. You know, these weren't being covered, so I went out and did a story for NPR on neglected tropical diseases. Then I started looking at numbers. You know, where is the disease burden? And the first global burden of disease study showed mental illness for DALYs. You know, I was just shocked. Number one, mental illness. Who knows about mental illness in developing countries? Who talks about it? It's not talked about in the media. It's not talked about within the countries because of the stigma. So I went out and I got some money in that case from the Carter Center and did a series on mental illness. It actually stemmed from a conference here. I don't know how many of you know Judith Bass, but she had hosted a terrific symposium on mental illness in developing countries. And I came and I sat next to a psychiatrist, one of the, at the time, 24 psychiatrists in Uganda, and she offered to make introductions to me for me in that country. So I went to Uganda, but it all came from Judith Bass's conference here. I had everything I needed, and I want you to listen to this in terms of what you can do if the media come to you for help with a story, because I'm going to talk a lot more about that at the end of the day. But, you know, she held the symposium, I was allowed to come, and I learned a lot and was able to go out and do something. The stories were a bit of a hard sell at NPR, I have to say. They have there's a high bar to get onto the radio. It has to do with your editor. I hadn't really impressed her with some of the stories I wanted to do, so I did some for NPR and then some for The World, mostly because it's fun to call people up and say, "Hi, I'm from The World." So that was another stab that I took at neglected diseases. And then a couple of years later, or non-communicable diseases, they almost go hand in hand. A couple of years later, I found myself in Seattle. I was freelancing and teaching, and I saw a poster for a talk at the Fred Hutchinson Cancer Research Center, which everybody calls the Hutch, so I will too. And this poster said, you know, come to the symposium on cancer in developing countries. Cancer in developing countries. I went into that thinking, they're just trying to get on. The global health in Seattle is next to Microsoft. It is the local business. I mean, it is the community identifies with it. I once went to a Bill Foege lecture that was sold out, it was about a 700-seat auditorium. I mean, people are really into global health there, with the Gates Foundation, with PATH, with, you'll excuse me, the University of Washington's Global Health Department. There's just a lot of interest in the area. And I thought, what's the Hutch doing here? I mean, cancer, there aren't many cases, there's no technology, people don't live long enough. So I went to this conference. This was one of the books that came out of it, which Harvard was involved in too. It was on cancer, and I found out I was wrong in every single way. Most importantly, the numbers. I thought the numbers weren't big. Well, one of the numbers presented at the conference was if you add together the number of deaths from HIV plus TB plus malaria, which if you ask the person on the street what are the big diseases in other countries, I hope some of them know enough to say HIV, TB, and malaria. Yes, true, more people die of cancer. That that floored me. And I know there's more to it than that. These infectious diseases would be even worse if we weren't doing something. And I'm not saying not to pay attention to these other diseases. They're vitally important. What I'm saying is we need to add in, or what I'm saying to my public. I don't know whether it's what I'm saying to you. I hope you know that already, but that we need to add this in. And I think things are starting to happen. You know, in 2011, we had the UN Declaration. And that, oh boy, did I try to sell that to my editors, and they were all looking at me, a UN Declaration? You know, it's very hard to get people excited about UN declarations. But it is a little easier to get people excited about things like a Lancet special series. Now, they've done now 2 special series on mental illness. They've also done a special series on non-communicable diseases. You know, my editors have heard of the Lancet. I can go and I can say, look, you know, here's a whole special issue. Their numbers are really a big deal for selling stories to editors. For example, when the Institute for Health Metrics and Evaluation, I mean, they're just a numbers factory, and you can go and pick up some of those numbers, and then your editor says, well, it's not really a big problem. He said, no, I've got these new numbers, and their new numbers are even better. I mean, Globocan has been doing the global cancer numbers forever, but having a new set of numbers, and I'm not saying this is a good thing, it just always gets the media interested. And talking of numbers, one good number really can make the story. I mean, this is how I sold, well, actually, the world really wanted these stories, so I shouldn't have to say I sold them on it. Look at this chart. This is deaths versus funding, and look at cancer deaths versus cancer funding. This is something I think the public can understand, and you can take it somewhere. And it gives you a news peg. It may not be new. It may be the same yesterday as it was tomorrow, but I've got these numbers, these new numbers that show it. So that really helps a lot. So I proposed this 5-part series, and this was the old front page of the website. They just finished redesigning it. I think this is the better version. I did 5 stories you can see down the right side. The first one on Jackson Orem you just heard. And I got funding from the Pulitzer Center again, which was very crucial. But how do you tell stories about depressing things, about people dying in other countries? Other countries, ooh, that's a challenge. People dying, oh, that's depressing. You look at the media today, you know, somebody just did an analysis of what's on TV news, and what they found is that sports, weather, and traffic are now the dominant thing on TV news. You know, this is what people aren't going to TV. People aren't going to the news to learn more about the world, especially because it might depress them. So you have to find ways to get to how do you tell the story? How do you tell a story that has some sad or bad numbers in it without making them making people feel bad? Oh. Come on. Well, one is to focus on an individual, and if you're lucky enough, you find somebody like Bill Foege, or you find somebody. Well, Jackson Orem was so shy, it was actually really hard to do a profile of him. When I asked him, you know, what was it like to be the only oncologist for 4 years in a country of 13 million people, he paused for a long time. He said, well, I was busy. So I re-interviewed him twice more on them, 3 times. Another lesson to you, if you're dealing with a reporter, and they seem to be a good reporter, and that's a big if, let him come back, because it took me that long to get that out of him. I wanted to make some stories that I thought were unremittingly sad. I wanted to make them a little upbeat, and I tried that with this story, which is a story about cancer pain. You know, there's a big pain movement that seems to come out of Britain for some reason, the stiff upper lip people, but everywhere I went to do this pain story, it was always Brits that I was running into. And one of the things they've been trying to do, you know, because so few countries use morphine for people dying of cancer. In some places, in some countries, people don't want it. They think it's a sign they're dying. In some places, the doctors won't prescribe it because it feels like they're giving up on the patients. Other places, there's no local manufacturer because of all the things that you can do when you're making morphine, and everything can get turned aside and it can be abused and all those issues. So one of the movements is to get countries to produce their own morphine. Uganda had just started doing that. And I went there thinking, oh, this is a good news story. So I had arranged to go on rounds with the pain people, and when I got there, they said, oh, we ran out of morphine 3 days ago. And I said, what's that about? And they said, well, you know, the government didn't do so well. So here was supposed to be a good news story. At least some people are getting treated. What you see here is what happened when my batteries died on my tape recorder. I went into another room to change the batteries. One of the doctors came with me, and she noticed there was a bottle. They used liquid morphine there. There was a bottle on the shelf. So this one person actually did get her pain medication. The first time I came by with the doctors, when they were talking to her, she was in incredible pain. She didn't have the strength to cry, but it just didn't look good, and her husband was just begging the doctors to do something. And that was going to be my story. Happily for her and for me, they found the morphine, and I had some action, and I had a story. I did another story on virally induced cancer, which is a science story, and sometimes you can get science stories through pretty easily because they're sciencey, you know. And what's the science? Here it was this doctor, Corey Casper, who's at the Hutch, is interested in virally induced cancers. He actually started out in Kaposi sarcoma as an infectious disease guy, came up to Seattle to study it. Guess what? There were no cases by this point because during the time he was preparing himself for this, antiretroviral therapy came in. But where were there cases? Uganda. So he ended up in Uganda, and he's studying viral causes of cancer. But again, with this story, it was as much a profile of him as the idea of virally induced cancers. And the story there was also helped by the fact that it's so new. Most people, not you people, obviously, but most people don't think of any cancers as being caused by viruses. And when you say 20% of the world's cancers are caused by HPV, by Epstein-Barr, by various viruses, what did I leave out? Hepatitis B. You know, some of the big number of cancers are caused by viruses, and you can treat that. You can prevent that with a vaccine. I mean, theoretically, if all the science falls into line, you can cut the cancer death rate in the world by 20% with vaccination. I don't think it's going to work out that cleanly, but at least theoretically possible. And that becomes news. People become interested. You're talking about a cure. You're talking about something that could happen. The next story I did was something that a lot of the work, was done here at Hopkins, or done by Hopkins folks a number of years ago on visual inspection with acetic acid to detect pre-cervical cancer. And that I did in India. The work was done, a lot of the folks were here, they were in India. So I went to India, and here's one of the slides they use to look at that. And that was an education for me. I've been doing global health stories for probably, I don't want to think about how long. And what was new to me was actually to be on the ground with something that they were trying. And what interested me here was it took this village where this is happening 8 years to accept this. It was a mostly Muslim village, and the women did not want to be examined. So they started doing what they did all the public health things you could imagine. They put the workers put on plays, they had videos, they offered things for the men as well. If you bring your wife in, you get a dental exam. In this town, they found out that the folks in this town were really interested in their blood pressure, so they would give them free blood pressure checks. But it took 8 years to get people to accept this kind of test. So that was that story. And where are we going next? Basically my goal has been with non-communicable diseases comes from Amy Goodman, who works for, she has her own show called Democracy Now! And when she said this, go to where the silence is and say something. Now, when I'm talking about silence, I'm talking about things that the public doesn't know. But these are all things that you know. This is what you're dealing with. These non-communicable diseases are out there. They can be made interesting, if a reporter finds out about it. And also, you guys can play a role. You can do your own direct outreach. And again, I'm going to talk about that at the end of the day, and I'm going to give you names and numbers and websites. And I really hope you take up on it. I always say the first word in public health is public. And if the public doesn't know what you're doing, you're not going to get funded. Maybe that's a little bit of an overstatement, but it helps with funding if people know about and care about what you're doing, as well they should. One of the real motivators for me was a Kaiser Family Foundation poll that came out they do every year, and it's not getting any better. They asked the public, what % of your tax dollar is going to foreign aid? And they give them a choice: 1%, 5%, 10%, and 25%. What gets the most? Most people say 25% of their tax dollar is going to foreign aid. And the smart people at Kaiser started adding a new question to the survey, which was, if you knew it was only 1%, would you want it to be more? And it's like 70%. I don't have the number exactly in my head. You can look it up on the Kaiser Family Foundation webpage. But a majority of people say, oh yeah, we would definitely want more money going to foreign aid. People don't know. They have no clue of how little of their tax dollar is going to this kind of effort, which is an effort that can really be important and have a huge effect on the world. So what's left for me to do next? I just finished a trip to Cambodia to look at two non-communicable diseases there, diabetes and high blood pressure. I did a story about getting people to eat brown rice in Cambodia. You would think, here's an incredibly cheap preventive that they should be happy to do. Well, they won't eat brown rice. They think it's the food of Pol Pot. So it's interesting, nobody wants to do what they're supposed to do, and everybody's got their own reasons. I love that story because the bottom line of that was we are all the same. We all have the same health issues. We don't want to do what's good for us. I did a story on hypertension, and I'm going to be doing a couple of more stories for the world, and then my next job is to figure out what disease to do next. So I'm going to introduce to you Dick Thompson, who was at Time magazine for 23 years, certainly during its heyday, and then he was a science correspondent and the bureau chief. And he was at the World Health Organization from 2001 to 2009. He headed various media teams there, and sometimes he had to deal with me. He headed the SARS team and the various flus, pandemic flus. He led the global media office, and he also wrote something that's very important and should be followed by all journalists, is the outbreak community, or actually all places that have information to share, outbreak communication guidelines. He's now senior advisor at the Pulitzer Center and a consultant at the World Bank. And actually, there was a little picture to go with that.
Okay, so now we're going to turn to tobacco. I don't have to tell the people in this room the role that tobacco plays in the development of non-communicable diseases and the role it plays in premature deaths. But there's been significant progress made against tobacco use, especially in the last 10 years. Strong policy measures have been enacted around the globe, and there's a large and growing body of scientific literature on what can be learned from these tobacco successes for other public health efforts. And the media has played a significant role in these accomplishments, as well as providing a vehicle for tobacco marketing. It's worth noting that today, it's been 10 years since the World Health Organization's Framework Convention on Tobacco Control was adopted. The Framework Convention was a significant accomplishment for global public health. It was the first multilateral agreement regarding a chronic non-communicable disease. And we're fortunate to have with us today Dr. Derek Yak, who for 8 years at WHO helped guide the framework to ratification. And thank you, Dr. Yak. While the tobacco industry lost the battle over the treaty, it certainly hasn't surrendered. In fact, it's spending billions of dollars to maintain and even expand its market share. The industry's focus now is on recruiting new users, especially women and children, and especially in underdeveloped markets, they call them, which are low and middle income countries. So how successful are they, and will they be? Over 500 million people alive today will die from tobacco use. What are the lessons to be learned from the tobacco efforts, and what can we learn from how the industry has responded? And what's been the media's role? And what are the ethical implications for the media in tobacco control and tobacco promotion? And we have two experts with us today to help us explore these questions. We'll begin with Joanna Cohen. Dr. Cohen has been involved in tobacco policy research and training for 20 years. She's currently director of the Institute for Global Tobacco Control here at Johns Hopkins. And the Institute has received recognition for its work and achievements by being designated as a partner in the Bloomberg Initiative to Reduce Tobacco Use. The Institute has also become a collaborating center for the World Health Organization. Dr. Cohen's research has focused on the factors that affect the adoption and implementation of public health policies and on evaluating the beneficial effects as well as the unintended consequences of these measures. Dr. Cohen will discuss the impact of news coverage on tobacco policies and individual behavior. And following Dr. Cohen's presentation, Ben McGrady will bring us a case study on media debates around tobacco control and international trade law. Dr. McGrady directs the Initiative on Trade and Investment in Health at the O'Neill Institute for National and Global Health Law at Georgetown University Law Center. This is an especially timely talk. In late August and early September, there was a flurry of editorials on a small tobacco provision in the Trans-Pacific Partnership, a free trade agreement that's still being negotiated for Asia and Pacific nations. The debate over this provision drew a chorus of condemnation from the New York Times, the Washington Post, and Michael Bloomberg. The press, Dr. McGrady notes, faces significant challenges when it comes to technical questions concerning the law. He will explore these issues and help and discuss how we can help reporters covering these complex legal issues. After these two presentations, we'll invite you to join us in a conversation with both speakers. Dr. Cohen?
Thanks, Dick. It's an absolute pleasure for me to be here today. And I'm going to talk a little bit about tobacco in the media, and I'm going to focus on two main messages. I'm going to talk about the importance of the media covering tobacco news, and I'm also going to give a couple of examples of the importance of investigative reporting. So I'm going to start here. This is a famous photo from the April 14th, 1994, from the hearing on the regulation of tobacco products held by the House Committee on Energy and Commerce, and it's a subcommittee on health and the environment. The chair is Henry Waxman, and in his opening remarks, Henry Waxman said, "An old proverb says that a journey of 1,000 miles begins with a single step. Today is the first step. Many more are to come as we deal with the most serious health problem facing our nation." And indeed, this truly was an auspicious statement. This was the first in many steps. This was really a watershed moment when what I think a number of people in public health knew for quite a while, but finally the American people knew that these tobacco companies were not telling the truth when they heard each executive one by one indicating that nicotine is not addictive. And this is just, let's see if we can get that.
I believe that nicotine is not addictive. I believe that nicotine is not addictive. And I do believe that nicotine is not addictive.
Okay. So after that, it was a whole other world in tobacco control, and all of a sudden people were willing to not, go against the company's rhetoric and say this is something we've got to address. All right, so the first point I'm going to make is that media coverage of tobacco-related news is important. And here are some headlines that came out of this very important hearing. So from the Daily News of Los Angeles, tobacco executives testify cigarettes are not addictive. From the London Times, tobacco moguls say cigarettes are not addictive. And from the Sun Sentinel, tobacco executives say cigarettes not addictive, and this is important, companies trying to avoid FDA regulation. And you can see even in headlines, you can convey a whole other sense. And really, this is what the companies are always trying to do, delay, avoid regulation, maximize profits for as long as possible. Indeed, as many of you know, with the passage of the Family Smoking and Tobacco Control Prevention Act in 2009, the FDA now finally can regulate tobacco products in this country. It just, took 13 years. staying on the point that media coverage of news stories, just regular news stories, is important, I just wanted to show you some charts from a study that I did with a number of colleagues, but led by John Ayres. And this, what we were looking at was trying to evaluate the impacts of World No Tobacco Day. World No Tobacco Day is pretty big around the world, not so big in this country because we have the Great American Smokeout in November, but World No Tobacco Day is May 31st, and it's a bigger deal in other countries. So what we were looking at was news stories and Google searches for smoking cessation around the time of World No Tobacco Day. So the news stories were archived on Google News. It collects stories from print, radio, and TV. We use nation-specific Google News domains, and we looked for stories that mentioned smoking cessation. And we focused on 7 countries in Latin America. They were Ecuador, Chile, Venezuela, Peru, Argentina, Colombia, and Mexico. So I'm going to show you a bit of a busy slide next, but I will walk you through it. So let's start with the top panel. And the blue lines are the news stories. Okay, so that shows news stories from 2006 to 2011. And the red lines are internet search queries for smoking cessation. So that just, the top panel, let's see if I can do it now. Yeah, so the top panel just shows the trends over those years. And then if we look over here in panel B, this sort of aggregates or gives the average of what's happening over the course of the year across the different months. And this dashed line is World No Tobacco Day, and it shows a peak in news stories at the end of May and a peak in internet people searching for smoking cessation. And then if we go to the last panel, this really breaks it down to daily searches, and you can really see between May and June that those spikes. And what's really exciting, I think, for this symposium is you can see the trends in news stories, and then searches are following those trends. And what we actually found was that I think it was a doubling of cessation news stories or coverage of, the stories that mention smoking cessation was associated with a 50% increase in internet, people searching for smoking cessation on the internet. So I think this is a really powerful information saying that just covering the news can really tap into people's, and we know that most smokers want to quit, so it really taps into people's desire and just another sort of push to look for ways to quit. All right, so let me move quickly on to investigative reporting. I'll give 2 quick examples. This was a story in February 1994, ABC's news magazine program Day One, covered the issue of, the report was about how tobacco companies are controlling the levels of nicotine in cigarettes. And quite impactful. It had immediate reactions, including President Clinton publicly remarking that he was very worried or disturbed by the fact that companies would try to increase nicotine in cigarettes to get more people hooked. This story did win a George Polk Award in journalism. However, it also won a lawsuit by Philip Morris, and it did end with a settlement where ABC had to make a public apology for the story, and there were other things involved in the settlement as well. So, but however, this did break the story. It did get people sensitized to a little bit of what tobacco companies are doing to make their products as addictive as possible, and again to maximize their profits. Let me move quickly on to the last example. This is it's called Tobacco Underground. It was a project of the International Consortium of Investigative Journalists, and they had reporters working in more than 12 countries to expose what's happening around tobacco, cigarette smuggling, and particularly how the multinational tobacco companies are playing a role in this. So these are the countries where stories came from. I think, so basically the reporters did long interviews with insiders. They reviewed lots of internal tobacco company documents to create their stories. And this just shows on the left, South America, some smuggling in South America, how Paraguay, whereas Paraguayans smoke around 3 billion cigarettes a year, Paraguay was producing 68 billion cigarettes a year, mostly for smuggling. And then China on the left is the world's epicenter of counterfeit cigarettes, and they get distributed around the world. So just to end off, these stories helped influence the negotiations for the Framework Convention on Tobacco Control's protocol to eliminate illicit trade in tobacco products. And so I think this might be a great lead into what Ben's talking about, but I just want to summarize by saying that my message is a very positive one, and that journalists can have a really important impact, not just in informing people about important news topics and non-communicable diseases, but I think even can have a direct impact in health and encouraging people to take action to improve their health. So thanks very much. And I'm going to introduce Ben McGrady to continue the story of tobacco.
Thanks very much, Joanna. Before I begin, I'd also like to thank Johns Hopkins and the Pulitzer Center for the opportunity to be here today. I think this is a really great initiative, and the case study I'm going to speak about, I think, will illustrate the importance of the work that the Pulitzer Center is doing now in trying to fund and encourage detailed stories around non-communicable diseases. I am a lawyer by training and was asked to speak about the role of the media in the law. I should disclose from the outset I had nothing to do with Philip Morris successfully suing ABC News, and I won't be speaking about that today. The topic about which I'm going to speak is the Trans-Pacific Partnership Agreement, a free trade agreement that's under negotiation between a number of different countries bordering the Pacific Rim, including the United States. But the story begins at the World Trade Organization. The World Trade Organization, as some of you may know, is a sort of multilateral organization governing global trade. It's governed by the World Trade Organization Agreement, which places some restraints on the ability of governments to regulate, including in the interest of public health. And those restraints are primarily that governments regulate in a way that it's non-discriminatory. That is, that they don't favour, for example, domestic products over imported products. But also that governments only regulate to the extent that is necessary to achieve a legitimate regulatory objective, such as protecting human health. Now, of course, what one person thinks is necessary is very different to what another thinks is necessary. And certainly what the tobacco industry thinks is necessary regulation in the tobacco sector is very different to what the public health community thinks of as necessary regulation. And so we've actually seen at the global level significant litigation around tobacco control measures. Here in the United States, the US government prohibited flavoured cigarettes, with the exception of menthol and tobacco-flavoured cigarettes. That led to a claim by Indonesia at the World Trade Organization against the United States, in which the United States was found to have discriminated against clove-flavoured cigarettes imported from Indonesia in favour of domestically produced menthol-flavoured cigarettes. The US has now been ordered to bring its law into compliance with WTO law, and Indonesia is arguing that it should reopen the market for clove-flavoured cigarettes as a consequence. We've also seen implementation of what's referred to as plain packaging of tobacco products in Australia. plain packaging being the removal of all branding from the packs with the exception of a standardised name and variant name, brand name and variant name, in a standardised font, style and size. Now, that measure has been subject to claims from 5 governments at the World Trade Organization and a claim from Philip Morris under an international investment agreement, which in essence allows the company to argue that the Australian government has taken its property and to bring those arguments before an ad hoc international arbitral tribunal instead of just the domestic courts of Australia. So we've seen a lot of controversy around the impact of trade and investment agreements on tobacco control and public health regulation more generally. Obviously, the public health community is up in arms about the issue, concerned that there are these international trade bodies that have some oversight of public health regulation. And it's against that backdrop that the story of the Trans-Pacific Partnership Agreement becomes an important one. Because in the context of that negotiation, there's now an important question of how tobacco should be treated. In addition to these rules that constrain governmental regulatory autonomy, we've also seen historically that as markets open, as governments lower import duties in association with their commitments under trade agreements, that tobacco consumption has increased, that the prevalence of consumption has increased, particularly in middle and low income markets that have previously been closed to imported brands. And so the tobacco control community has been arguing primarily for exclusion of tobacco from the Trans-Pacific Partnership Agreement, so that the agreement will not govern tobacco at all. On the other hand, the US Office of the US Trade Representative has indicated that it intends to table a number of different proposals in the negotiations. One of those proposals would have specifically recognised a new exception for science-based tobacco control measures. I'm sure there are a lot of you in the room who are scientists, so I'll leave it to you for the moment to try and determine what science-based might actually mean in an international treaty. Obviously a complex issue. Following criticism on the basis of the complexity of the proposal, the US Trade Representative changed it to simply recognise that tobacco control measures are measures to protect human health, therefore falling within the scope of some specific exceptions that might be included in the agreement. The media has also picked up on the tobacco industry position and the industry position generally, which is to preserve the status quo, not to change the rules in any way. What the media has missed entirely, however, is a fourth position. And that's the position of the Australian government, now also the position of the Canadian government, which, oddly enough, is completely in line with the position of the tobacco industry. So we have, on the one hand, the tobacco industry saying, don't change the rules, don't change the status quo. And we also have the Australian government, which is being sued by the tobacco industry in every forum it can possibly be sued in, saying exactly the same thing. The Australian government is saying that because it's concerned that any change to the rules might suggest that, in fact, it's not entitled to implement the types of measures that it's implemented under the rules that already exist. But this nuance, this nuanced position as compared to, on the one hand, excluding tobacco products or proposing a new exception, has been totally missed by the mainstream media. And as Dick mentioned, we've seen editorials in the Washington Post, New York Times, Wall Street Journal, and those editorials on this issue have largely parroted the media releases of different organisations with an interest in the subject matter. Some of them tobacco control and public health NGOs, some of them the industry. So the Wall Street Journal lined up behind the tobacco industry and other industry groups. The New York Times, Washington Post lined up behind the public health community, arguing that tobacco should be excluded. But unfortunately, they have, because they've missed this Australian government position, now also the Canadian government position, they've missed the true complexity of the issue. And herein lies my central point, which is that the mainstream media is well equipped to deal with issues of social choice, to deal with political choices between protection of human health, for example, and tobacco control. But when it comes to complex legal issues, it's not particularly well equipped to actually identify what the issues are and how different options might affect protection of human health. And there are various reasons for that. One reason is that lawyers tend to monopolize information because that's ultimately how they make a living. Another reason, which has been mentioned already, is simply lack of resources. That the mainstream media does not have sufficient time and money to investigate these complex technical legal issues in order to convey the stories in a way that's both accurate and compelling to their audiences. So the overarching point here that I'd like to make is that mainstream media has a very important role, I think, in political and social choices. And it's important that they are engaged on these issues with non-communicable diseases and the law. But there is a big challenge, a really large challenge, when it comes to these technical legal issues about or for which they have little capacity. Thanks very much.
Well, thank you both. Those were great presentations. We're going to open up for discussion now. I'll invite the speakers to come back and join me here at the podium. There are microphones that will be available to people in the audience when you have your questions. If you pose a question, please identify yourself, and then we'll get to it. We have just a few minutes, so let's get started.
I wanted to expand on what Joanne started, wonderful stories from Uganda and others. What is happening in sub-Saharan Africa, and the media probably can help with this, is that it is the training of the clinicians and the policymakers and everyone else. At the time, they just made this clear dichotomy between communicable diseases and non-communicable diseases. Whether the governments realize right now or not, the non-communicable diseases are certainly expanding, and diseases like HIV and the things that we have been addressing recently, now we have come to realize that there are associations between HIV and the treatment, the antiretrovirals themselves, and these non-communicable diseases. The media, I thought there are two things that can help. One is probably focusing on the risk factors. Two simple things, for example, will be the lifestyles. I mean, the type of food they are eating now, and everyone moving to the urban centers, and everyone probably eating white bread, putting pressure on what is available and abandoning the good things that they used to do. The other thing is the exposure of the local media to this information. I mean, if the local media is not focusing on NCDs, it is unlikely that they will read, although it is becoming available, of what is happening now. So I just wanted to reflect on this.
Okay, thank you. I'll take, if you don't mind, I'll pose a question to her. Ben, you wanted to talk a bit about the ethics of journalists in this area. So I'll let you expand. Sure.
Yeah, obviously this is an issue where the media can play an immensely positive role, but also an immensely negative role. And for the vast majority of time, that role has been immensely negative. In the tobacco context, we see today widespread or comprehensive restrictions on advertising, promotion and sponsorship, and in many countries, laws that really limit the ability of firms to engage in tobacco marketing. But in those countries where we don't, we see the media largely open for business with the tobacco industry. And the tobacco industry is demonised, not just by the public health community, but more broadly in society, while the media and those outlets happy to take tobacco industry money and promote their products walks away largely unscathed. It's just seen as a part of the way in which they do business. And that, I think that's quite questionable.
Yeah, I'll echo that, and I mean, there are countries where a lot of progress has been made. We just published a study last week in Pediatrics which showed that in China, almost 9 out of 10 5- and 6-year-olds could recognize at least one cigarette brand. And that's an example of how the media is promoting tobacco products. So it really is a dichotomy.
You know, I don't know if I mentioned it, but the Framework Convention on Tobacco Control, I think there are 177 countries that have signed on and ratified, but the U.S. isn't one of those countries. Okay, another question? Yes, in the back?
Yes, my name is Michelle Farmer. Thank you very much for these presentations. I wanted to piggyback on the comment this gentleman made earlier about the issue of the dichotomy between non-communicable diseases and communicable diseases. The concept being that sometimes we find ourselves polarized at a time when we really need to be unified. And I'm wondering how perhaps we in the healthcare community might work with some of you in the media to work together. Yes, our resources are thin. The number of reporters are going down, and in some of these low and middle income countries, we often talk about the lack of capacity of the workforce or workforce shortages. So maybe this is an opportune moment for us to try to find ways for us to join forces and integrate our efforts to the public good. And I'm wondering if you can give us either some suggestions for how that can be done on an active way, and maybe perhaps tell us about some of the things that you are doing actively to really integrate, not just the one-on story, but really in a meaningful way, integrate our efforts so we can get the word out. Thank you.
Okay. Yeah, I guess that's me. I think that Joanne is going to talk about this a bit later, but I think you'll have a hard time convincing reporters that they're collaborators in doing good for public health. I don't think that that's how many reporters approach their job. But when I was at WHO and I was running media teams there, it was clear that this chaos that was going on in journalism could be used for our advantage. We could publish stories, we could present stories, do releases, extensive releases that were exactly like stories, provide B-roll, provide audio interviews, and so on, and reach out to the media, because the media was understaffed and overwhelmed, and if we gave them complete stories, they would run with it if we maintained our credibility, if we maintained the trust we had with the public. But if we did anything that would endanger that, and there were lots of people at WHO who would endanger that, then we wouldn't have that opportunity. So I think if you look at what's going on in the media now, there is an opportunity for public health to reach out more deeply than they have in the past. I'm sorry to take so much time. Are there other questions? Yes.
Thanks, David Jernigan. You'll hear from me more later, too. But I thought Joanne Silberner did a great job of talking about how difficult it is sometimes to sell these stories. And you were talking about the trade agreements. And journalists always want to put a personal face on a story. How do you put a personal face on the trade agreements?
Great question. I didn't bring any PowerPoints, but it's not so much a personal face as it is a picture of an eyeball or of tongue cancer or heart disease or stroke. And that's the way in which it's usually put, and they're the kinds of images that we see on graphic warnings on tobacco products. And certainly in the case of the Australian litigation, they cover 80% or more of the surface of the pack now. And so there is this sort of information campaign around those sorts of issues, I guess in some senses a shock and awe campaign. But it's a very important point that you make, is that these areas, particularly international trade law, are very difficult to sell to a mainstream audience. I know that if I go out to dinner with my wife, I don't talk about international trade law at dinner, as an example. We wouldn't be married if I did. So I think it's a very, very fair point. And we tend to see reporting in the press that's related to economic issues, whether it's the Financial Times, Wall Street Journal, or some professional publications that have a specific interest in these issues, rather than in the more mainstream media.
So you mentioned a number of times that the media has missed this part of the story. Have you reached out to the media, or what have you done? You have?
I mean, personally, I've spent a lot of time speaking with reporters, including about different aspects of the story. But it's an extremely complex story, and one where they have tight deadlines and very limited periods of time. So that part of the story really hasn't come out publicly. Instead, what we are really seeing is the mainstream media picking up on either press releases or very short, simple policy documents released either by groups in civil society or by industry groups. And in many senses repeating them. And you gave an example of how WHO, through its press releases, can really place stories, particularly in an environment where media resources are low. Exactly the same thing happens on this issue, happens at the hand of industry as well. You constantly see industry press releases that are then basically parroted as a news story by mainstream media.
Sure. We have time for one more question. Good. I'll take it. Oh, okay. Go ahead.
Hey, I'm Jaron Jones from Coppin State University, biology student, undergraduate. I just wanted to know, I keep hearing public, right, and you're talking about corporations, like executives in the tobacco industry, and I don't know exactly what you mean when you say public now, because now we're talking about Canadian government, Australian government, and it seems to me like if they're willing to be so open as to, make a declaration saying they believe that tobacco or nicotine is not addictive. I mean, if they're already that open and people don't see that, or you say that the public isn't informed, then, I mean, what real difference can be made? I mean, is there an example where, something stated like that was brought to the public's attention who possibly didn't know, which I don't think is possible, where there was a change in something that was harmful, like, like cigarettes being banned or anything like that? You see what I mean? Is there any example where that's given, where that happened?
I think that's a great question. Unfortunately, in public health, change takes a bit of time, and you can't measure success, unfortunately, in days or weeks, and sometimes years. You have to look over decades to see changes. And I would say that photo and the audio clip of tobacco company executives basically lying to the American people really was a watershed. And we saw change 13 years later in this country with strong legislation that allows the Food and Drug Administration to finally take nicotine out of cigarettes almost to zero, almost all of it. But they could if they wanted to, and they can do a lot of other things with tobacco products. And so it does take time, but it has led to changes that I think have been now, because of that, acceptable to the American people.
Okay, we're going to take a 10-minute break here. When we come back, we'll be with Dr. Derek Yak. Thank you. Thank you.
forward at the challenge of obesity, diabetes, hypertension, alcohol use. In short, all the non-communicable diseases that are on the rise but lack the infrastructure that tobacco control advocates have built to address the crisis. We'll hear first from Dr. Derek Yock, who will share his experience at PepsiCo and some potential paths forward on non-communicable diseases, with a focus on the role of the news media. And then we'll have responses from Bob Lawrence and David Jernigan, both of whom I'll introduce following Dr. Yock's talk. Dr. Yock is an international healthcare policy analyst. He's currently the executive director of the Vitality Institute for Health Promotion and senior vice president of the Vitality Group. He's had a storied and controversial career in global health that has seen him in roles ranging from leading the development of the Framework Convention on Tobacco Control as executive director for NCDs and mental health at the World Health Organization, to being the senior vice president of global health and agriculture policy at PepsiCo, where he worked to make changes to make the company a force for improved health. So let me turn it to Dr. Yock and we'll proceed from there.
Thanks enormously, and it's wonderful to be back home at the a lot of things in my career started, and a lot of early ideas started to germinate, and wonderful to have Dean Klug with us as well. I think that the opening comments the Dean gave us, I think, really were very interesting, because it was his effort to do what the media start to do very well, and that is to frame the issue. So if you listen to his opening words, his frame was that it was really about the deep worries we have about big tobacco, big food, big alcohol causing these dreadful things around the world, and that the solution was going to be they must all change, be legislated, regulated, or just go away, and everything will be fine. Whether it was so easy. And I think the one thing I learned when I left these halls was that the books often make it sound too easy. The real lived experience is rather different. So let me give you some of that real lived experience. But let me start off with one of the greatest media stories that didn't really make it all that far in one part and yet changed the world in another part. In 1975 and 76, two little booklets came out. One booklet was called Baby Killers. Anybody ever heard of it? The book was about Nestlé's activities around the world and spurred the debate that led to the Nestlé boycott in the US and around the world, and led to the persistent, continuous distrust of the food industry, in my view, and led as well to Nestlé being seen as the bad guy. I'm not defending or not defending the issue. That's the way it got painted. The story would never have gone global if Nestlé themselves hadn't taken this book and translated it from its English version. It was actually published by Panos in the War of Want. And I've got the original one. You can still get it probably on eBay, secondhand. And it's a very powerful little book. But the German translation immediately got into the German NGOs, and it became a global issue, and a massive, massive campaign started that really has not completely ended. The second book was called Smoking in the Third World. The same group, Panos, World on Want, published the same little book, same size, also same period, showed the dangers of tobacco in the third world, mainly in Africa, and showed the pictures of BAT painted towns in Kenya, the environmental consequences of farming across much of Africa. That one went nowhere. Nobody knew about it except a few of us who were trying to do work in tobacco control, And when I came here, I was inspired to start writing a bit later about what was happening in tobacco control in Africa. The interesting thing is that the same person authored both the books, and his name was Mike Muller, a South African colleague who then joined Frelimo and fought until Mozambique got its independence, when he switched back to South Africa and became the first Director General of Water Affairs under the Mandela government, and is now head of economics at the University of Witwatersrand. I mention it because one story made it, one story didn't make it. If that story had made it, we probably would have had the tobacco treaty a couple of decades earlier. We probably would have had substantially more action. And I'm always left with this question of why. What happened? Why was it that they were able to galvanize through the baby killers a movement that persists today with, I would say, many views that actually need to change if we're really going to make considerable progress, whereas on the smoking side, we didn't see that progress. I think that, and I'm hoping that in the discussion we can get into that. Throughout my career, I've always been aware that the media is absolutely critical to the framing of the debate and to what story they put their spotlight on. When they put their spotlight on the story and frame it in certain ways, you can see action. Now, that action, as you so correctly pointed out, the role of the media is never to pick up a story and do the work that we should be doing in public health, but it's to run the story. And I'm always reminded of some work that colleagues did in Finland way back when they looked at tobacco and decided in the late 60s and early 70s that they wanted to transform the tobacco legislative landscape at a time when there was very little going on. And they knew that taxes, bans on smoking in public places, all these things would probably have an effect. They didn't have the evidence because nobody had done it. The question was, should we do it all in one shot, or should we do it incrementally over the course of decades? They took the latter view, and the evidence seemed to show that the benefit of going back over many years meant there was a strong media discourse each time something was tabled in the parliament. The discourse itself seemed to stimulate behavior change in much the way we heard earlier that when you land up having some of these reports coming out, people actually start quitting around smoking cessation days. The 1964 Surgeon General's report, there are many examples of quit rates accelerating after that report. Well, when there's a discourse in the media, and it doesn't matter which way it's going, as long as it's an open, strong discourse, I get the sense that behavior change tends to move in the right direction. And if that's true, and if we can nail it down, what we should be doing is encouraging more general debate in the media, even if it's quite contentious, and especially maybe it's quite contentious. I like to think of the portion size debate that Mayor Bloomberg started as being probably a great example. And let's look to see what has been the impact, not on whether he wins or doesn't win on the regulatory side, but on the portion size debate, which I saw inside PepsiCo, started actual changes in the way portion size was seen, regardless of whether it was being opposed outside. We heard a lot about tobacco control, and before I just jump to food, I want to leave that area asking one question: what were the media stories I really would like to see now covered? And some of them do fall into the investigative area. Without the Minnesota court case, we would not be where we were with the treaty. And the Minnesota court case, Michael Cerisi and his team, you may very well know, one of the outcomes was the release and the disgorging of millions of documents that allowed us to walk through the minds of tobacco executives, understand how strategy was built, what they were going to oppose, understand that when you saw that they said nicotine is not addictive, in the 1960s they had documents which showed that the purpose of a cigarette is actually to deliver nicotine in as efficient a way as possible. So if we look fast forward, what today would I want us to see the media focusing on that I think are some stories that they're not addressing? To me, the biggest one is the shift in who's making, selling, and distributing tobacco. It's no longer the major multinationals. China is producing 40% of the cigarettes smoked on the planet, and yet I've yet to see detailed studies talking about what that's going to mean, not only for the importance of China as a producer and exporter, but their ability and often their willingness to ignore local legislative and regulatory standards in a way in which if US and European multinationals go that route, they'll pay heavy penalties either in terms of their own government legislation or in terms of the way the investor community deal with those kind of stock. That is a growing concern. The second one, which was highlighted, was the fact that while we've all been talking about the Framework Convention generally, I went back to it, and one of the failings that we never did was to have a stronger gender focus. The shift in the gender distribution of smoking among girls has been profound. And if you look at every country in the world for which there's data, the ratio of boys to girls has closed in the wrong direction for girls, basically meaning that we're seeing dramatically increased proportions of girls smoking relative to boys compared to their parents. That means that we are sitting at the start of what is going to be a large-scale epidemic of tobacco-related death and disease 40 to 50 years from now, which is inevitable unless we take very serious action quickly. That has not been addressed by any of the women's movement. It hasn't been addressed by UNICEF, who still refused to address the issue of tobacco and only did so once 10 years ago. The third area, I would say, and is the most contentious, is the impact, positively or negatively, of e-cigarettes and the new nicotine delivery devices. If they are potentially going to have a positive disruptive effect, it will be huge. And it will have big impacts not just on cutting the death rates, but cutting the tax base for tobacco, as well as challenging a lot of the legislative and regulatory theory that we've built up over many years. Despite that, we are not yet seeing the debate happen at the level we should, and we seem to have a polarized discussion out there about them either being good things or bad things. We should look and see. Clearly what's needed is some leadership from the scientific and research community to get the science right and to think of what are the real concerns and how do we address them if there are real concerns. So on to food. For me, the food issue started when I was at WHO, and we were still finishing and winding down the work on tobacco. We wanted to start off by looking at a report which asked the question, what should be the dietary guidelines for the world? A nice, modest task. And we basically came out with a report called Report 916, which was a very boring technical report in a pale blue color, not particularly exciting. Media found no interest in it. But we didn't know, in its preparation, we would unite the sugar, palm oil, meat, cattlemen, salt, and every sector against WHO for every single product line that we said you should eat a little bit less of. Now, we shouldn't have been surprised at that, but that is the reality. The most vociferous ones were the sugar lobby, and not just companies, but particularly the Sugar Association, where we had to face barrages all the way from the Sugar Association of Mauritius saying we were undermining the economic impact, the economic development of Mauritius, all the way through to the palm oil lobby, when the Malaysian and Indonesian government told us that we were eroding the capital base of Indonesia and Malaysia by saying that you should have a little bit less palm oil, or the salt lobby, who were telling us that we were eroding the gains being made in the fight against goiter and iodized salt if we were going to have less salt and reduce hypertension. And so it went on and on and on. What I saw there was that unlike tobacco, where it was very easy to paint a nice, clean media story, there's bad and there's good. There are victims and there are villains. Very easy. And the solution also very easy. Let's just demonize them, tax it, legislate it, regulate it, and everything will be fine. And that's really basically what we try to do. But for the food sector, when I was in WHO, and my colleagues and Dr. Brundtland at the time knew that we wanted to send a different signal to the private sector, that there was the potential to work together. And we did that. And the first series of meetings actually were with the CEOs of the food companies, something we never did with the tobacco companies. But I must say we did meet the tobacco industry. I always felt, and I still believe, you have to speak to everybody whether or not you disagree with them, where the current WHO position is, no, just wish them away. The people we spoke to and invited to WHO were the tobacco industry scientists to hear how they were going to accelerate their harm reduction programs. We weren't convinced they had anything interesting at the time, so the meetings never went forward. But with the food industry, there was a set of issues outlined that were going to be taken forward. They were making pledges around, okay, we'll start addressing marketing. They weren't sure if WHO was going to get going. This was 10 years ago. This was the start of what has become continuous pressure driven by consumer demand, better epidemiological evidence, a lot of your work, but a galvanization of efforts. We thought that there was strategically a different way forward. The media response tended to be, no, there can't be a better way forward. Let's really paint it the way we did on tobacco. There must be big, bad food, and there must be the good saints in the food and sector, particularly coming from places like Hopkins, academic institutions, NGOs. And let's play to the angels and listen to the angels. And of course, then at about a few years later, when I landed up joining the villains, I became a villain as well, and part of the story. And what did I find inside PepsiCo? I found, first of all, a CEO who had the same passion to change that I saw in Brundtland when I joined her cabinet. And did she have any proof that she was going to change PepsiCo? And I always remind people that when she was chief financial officer a decade ago, she was the person who sold off Kentucky Fried Chicken, Pizza Hut, and Taco Bell, sold them, because she wanted to make a clear break with the past. And what did she buy? She bought Tropicana and Quaker, along with Gatorade. Now, many of you may not like Gatorade, but it was seen at the time of sports drinks were perfectly inert, but certainly Quaker was seen as the brand par excellence that exemplifies a healthy way forward. And she made those switches as a financial officer, not yet the CEO. So I was brought on board, and her goal to me was to say, continue what you've done at WHO and with your NGO colleagues, but speak honestly about it internally. The media response was a disbelief. We can't believe any of this is true or honest. And I think to this day, there's still ambiguity out there around whether small steps made, as opposed to giant leaps, are in fact going to bring us to where we are. And in discussion, we can go into them. So if I look back now and then ask the question, in the same way of tobacco, what are the questions and what are the media issues that I think they're missing beyond the simple one of big bad food in repainting the tobacco story? I think the first one is understanding the constraints that food companies face in detail, seeing the intimate links between agriculture and food pricing, the whole drama around commodity prices and why do we have fruit and vegetables becoming far more expensive when corn, soy, and palm is becoming ridiculously cheap. And we actually want a world based on the former rather than the latter. That constrains what you can do if you want healthier foods. Kind of simple. Second, there's a pesky thing I learned about in the food companies called consumer demand. When I was in WHO, we never really focused on the interests of consumers or people when they actually make purchase decisions. We did epidemiological studies, yes, but we didn't go into their innermost desires and what happens as they reach to buy A versus B and how do they make these decisions and how do you maximize that for health purposes. We didn't really do that. Companies are far more smart at this, and they've learned that obviously taste and flavor and price matter. How we actually get them right is obviously complex. And we've seen in the last few months an example, I think, of stunning disaster happen while the media has said nothing about it, while there's a stunning success going on. So the disaster is the resurrection of Twinkies. Twinkies was almost dead. It was going into bankruptcy. It was in bankruptcy. It was bought back from the grave by some investment bankers, and none of the media painted this as an absolute disgrace. Why didn't they go after the investors and talk about their greed and the fact that they are knowingly now putting back a product onto the market that is going to lead to considerable ill health problems? The positive story they also don't want to write about is the great victory we're seeing in sushi. Sushi can be bought everywhere in this country. It's a really complicated chain to achieve. 85% of the stuff is being imported into this country. The more people eat sushi, the more their omega-3s are going to go through the roof and hopefully they'll live forever. Nobody is driving the sushi story. There isn't a massive sushi marketing campaign. So what is happening? That some consumers, whether they're in the Midwest, in poor parts of the country, are turning to sushi as a desirable, healthy food. And what does that mean if we want to address other healthy foods? There's a big story there. So any potential journalists here should be following that one. The third story is related to behavior change. Sorry, it was related to investor relations. And this is one where the dark side needs to really be painted. The great investigative journalism done on tobacco has not been done in the investor community. We have yet to have a serious discussion around the fact that there are what we can call activist investors, a small group who go into companies to destroy them, to extract maximum value for greed, and demand that they do not do what's in the best interest of sustainable development or health. For example, no surprise, you read the paper, you'll see that PepsiCo had been under pressure to do just that, cut out R&D, stick with their knitting, compared to what the institutional investors are saying. I think the public health people need to realize that there are opportunities for them to engage in the responsible investing community, who put out reports like Bank of America and Merrill Lynch, who reviewed all of the food and pharma companies to ask, how do we incentivize companies showing change in terms of reducing the obesity epidemic? The same is happening with a recent report that UBS put out that was partly supported by Gates and the Wellcome Trust. And I'd be happy to go into that later, because unless the public health folk work with the large-scale investor community, you won't see shifts. And the investors of the future, large-scale ones, are asking questions around what is this company going to do 5, 10, 20, 30 years from now? Those are the companies we want to invest in. That is a new area for public health to engage with the investment community. So let me end by saying that the most important thing I learned when I was here at Hopkins was the power of epidemiology as being the base discipline for all of this. And I say that both to you as students as due to the media, because we often don't frame the role of epidemiology as being the core discipline for deciding who are really the villains and who are really trying to make progress. If we did, I think we'd find that some of the causal arrows to long-term change may be coming in very unlikely places. And I would hope that's something, again, we can continue in the discussion. Thank you.
Thank you, Derek. I was so busy writing notes I ran behind getting up here. It was great. I'm now going to introduce Dr. Lawrence and Dr. Jernigan, who will respond to Derek's comments. Dr. Bob Lawrence is a co-founder of Physicians for Human Rights and has participated in human rights investigations in Chile, Czechoslovakia, Egypt, El Salvador, Guatemala, Kosovo, the Philippines, and South Africa. He's the founding director of the Center for a Livable Future at the Bloomberg School, which focuses on the relationships among diet, food production systems, the environment, and human health. Dr. David Jernigan has written about and worked extensively in the field of media advocacy and how to use mass media to influence public health policy. He's currently the director of the Center on Alcohol Marketing and Youth, CMOI, and an associate professor in health, behavior, and society here at Hopkins, which involves leading research on monitoring youth exposure to alcohol advertising. So first we'll begin with Dr. Lawrence, and then Dr. Jernigan will follow him. Great, thank you.
Thanks very much. It's a pleasure to be here today to talk about these important things. I do have a little story about Derek Yock to start off with. When I was director of the Health Sciences Division at the Rockefeller Foundation, a position that Derek subsequently held, division directors had a discretionary account in which we could make grants of up to $100,000 for a year without having to seek permission beforehand. We did have to report back to the board afterwards. Derek applied for, I think it was $78,000 to hold the first Pan-African conference on tobacco control in 92 or 93. The president of the foundation, when he saw my report of how I had spent my discretionary dollars, said, why did you do that? Tobacco, that's not a problem in places like Africa, is it? So ignorance about the threat, these indolent threats of chronic disease are not confined to journalists who were following the dictum of what bleeds leads, not confined to people who look at television only to see weather, traffic, and what was the third one? Sports. But it's actually difficult to keep the attention of people, knowledgeable, thoughtful, educated people, on big issues when they are so slow in developing, like the old proverb about the frog and the pan of water that's slowly heating and he doesn't realize it until it's too late and is a poached frog with no escape. I want to start off with a challenge that I think is consistent with chronic disease issues, certainly with the food industry, and that is sometimes there are competing issues embedded within the same story. And I think that journalists have a real challenge to try to sort out what is the really heart of the matter, what's the part of the story that is going to lead to better outcomes for the general public. Now, we recognize that journalists' role is to tell the story, and it's those of us who are concerned about protecting the health of the public who have to provide the information. But a study that was done within the Center for a Livable Future in collaboration with one of our colleagues in health policy and management, Kate Smith, looked at the media coverage of the Gulf oil spill. And they found that there were 315 articles covering the spill over the period of 8 months that they sampled. Only 28 out of these 315 articles offered any guidance on how to reduce risk of exposure to seafood contaminated by the oil spill. Aromatic hydrocarbons are carcinogens. There was a lot of concern. We didn't know exactly what was in the water. There was a great deal of confusion initially on about levels and which part of the biota and the water column was being most affected by this dramatic oil spill. But even more problematic than the fact that only 28 of the 315 articles talked about ways of guiding the public, the readership of those articles, how to reduce risk. None of them actually mentioned the countervailing benefit of eating seafood. And given that in the United States, virtually all of our oysters and crayfish in the southern part of the country come from the Gulf, and a tremendous amount of the shrimp that's consumed. So here was a situation where the media was covering the equivalent of the sports, the traffic, and the latest car crash and murders. That is, the big event, the explosion, the deaths, all of which were important to cover. But then as the spill continued and over time there began to be these hints that maybe this was a really big issue with regard to ecosystem health and that that had implications for human health, was virtually ignored. Another example of what I think Derek lays out very nicely about the fact that we do tend to see things as victims and villains. You mentioned processed food, and almost everybody who is a foodie, and that includes all of us in the Center for a Livable Future, we immediately say, processed food, bad. But in fact, the reality of modern life, two-career families, hectic, busy schedules, is that it is not only utopian, but it's probably totally unproductive to think that by restoring a greater amount of grains, fruits, and vegetables in the diet and doing all those things that Derek suggested would be healthy, that we're going to somehow also get people back devoting their time for cooking from scratch and preparing whole foods for every meal 21 times a week. we have to look more closely. If you look at some of the things that are now being put forward as healthy alternatives, some of these drinks that are made with various concoctions of soy and healthy components, each of which is quite healthy. But if you look at tofu, it has a wonderful source of high quality protein, but actually, ounce for ounce, tofu has more fat in it than many cuts of lean meat. So we have to take a balanced view. The real total ecologic impact of our current unhealthy food system is going to require some totally new solutions that will include borrowing a page from the industry's emphasis on taste and convenience, but using our knowledge of public health and good nutrition to make those processed foods healthier. We hosted here about a decade ago a meeting of the Chain Restaurant Association. It was in the spirit of, well, let's get the industry leaders here and let's talk about some of these things we're so concerned about. It was a day-and-a-half conference. Half a day, we gave them as much science about healthy nutrition as they could tolerate. Half a day, they met by themselves to digest what we had talked about in the morning, and then the third half day, we came together to try to see what solutions there would be. The senior vice president of Wendy's said to me during one of the breaks, he says, you know, our cost for the salad bar in Wendy's is 4% of our total budget. It's only 3% of sales. Unless we turn that around, we're going to have to get rid of the salad bar. And he almost had me until I stopped and said, but wait a minute. Of your marketing budget, how much is devoted to the salad bar? At which point he had to confess that it was minuscule. So we now are in this situation. $14 billion a year is spent by the chain restaurant, beverage, and candy manufacturers in the United States. $14 billion a year to get us to eat essentially an unhealthy diet. When the National Heart, Lung, and Blood Institute promoted as part of its hypertension awareness and cardiovascular disease control a campaign to educate people about the importance of 5 servings a day of fruits and vegetables, their total social marketing campaign was $180 million over 4 years. Less than a rounding error of the $14 billion that is spent. Now, I haven't seen the media tease that apart. That's a rich area for real investigative reporting. Derek mentioned the portion size that Michael Bloomberg tried to push through with regard to sugar-sweetened beverages in New York City. Ultimately, the coverage, even in the New York Times, became a coverage of a debate between freedom of choice and the nanny state. In fact, what Mayor Bloomberg was trying to do was educate the people of New York about the hazards of high intake of sweetened beverages, whereas the beverage producers, their piece of that $14 billion a year of marketing, had been using that to get people to drink larger and larger portion size for more than a decade. So it's an unequal playing field, and then to have the media miss it by saying, well, it comes down to how much can you regulate before you become a nanny state, lost the true opportunity, in my view, to make a tremendous statement for public health. Thank you.
I am PowerPoint dependent. As the introduction said, I do teach media advocacy. I spend a lot of time trying to grab that media spotlight. It is challenging for the issue I work on, which is alcohol. I'll talk more about that. I do very much agree with Derek's point about the discourse itself can change behavior. And it's something, I work with communities all over the country on alcohol issues, and taking on the effective strategies, even if people don't win, simply raises the issue in a way that it isn't often raised, and that's a lot of what I want to talk about. So I want to start with a counter ad. And there are very few counter ads in alcohol, but this is one produced by a young people's group in Dover, New Hampshire.
Hello? You're listening to radio station WY2Y.
And now it's time for our question of the day.
You can win $10,000 if you are the first caller to answer today's question correctly.
What do the following words have in common? Date rape,
Balls, violence, liver disease, accidents, unwanted pregnancy,
depression,
alcohol poisoning, suicide, STDs, and addiction.
Well, I guess the time is up, but no one has answered today's question correctly. Joe, please tell us what the answer is.
They are all words you've never heard in a beer or alcohol commercial.
The beer and alcohol companies spend billions of dollars a year on TV and other advertising. But have you ever heard them use the word addiction or any of those other words? We're warning you about the consequences of alcohol abuse because the alcohol industry refuses to. They're probably, well, just too busy counting their money.
Created and presented by WTUs.
Okay, I want to make 3 key points. That first, alcohol. Joanne talked about speaking into the silence. Alcohol is often the missing person in health and safety stories. That the alcohol problem definition in the conversation we have about alcohol defines its solutions, and that the solutions are very limited and public health research about solutions is widely ignored. So first, alcohol and health. Among the 5 leading causes of death and disability, leading cause of death and disability for 15 to 24-year-old males worldwide, except in the Eastern Mediterranean. Leading cause for females 15 to 24 in the Americas and the high-income countries. Very predictable. As national incomes rise, alcohol consumption will rise and alcohol problems will rise. We see this over and over again. We've seen it particularly in Latin America and in the transition economies of Eastern Europe, where there was already a big problem. And third leading actual cause of death in the U.S. Alcohols play a harmful role in more than 200 disease conditions, and I'm not going to go down the whole list. But it's a lot. And these are some of the more familiar things that alcohol plays a role in. But I want to move from that to then 3 recent stories here in Maryland. So I want to go very micro now. And many of you may have seen these stories. They all happened in the last year and a half. The first was 2 teenage girls who were sitting on a railroad trestle, and they died when a train derailed behind them. It was filled with coal. They were buried in coal. A couple of stories happened to mention that they tweeted just before this thing happened that they were drinking and how drunk they were. Very little focus on any of that in any of the rest of the stories, because God forbid we should ever imply that these girls were in any responsible for this awful tragedy, and yet there was an alcohol piece. And then many of you heard about the University of Maryland graduate student who shot 2 of his roommates and then killed himself. He was also drunk at the time of the crime, and turns out about 50% of homicides occur when the perpetrator has been drinking. And then we had the Maryland legislator who was in a drunken boating incident and then later arrested for DUI. And here alcohol was unavoidable, but the frame on it was not the alcohol. The frame on it was bad legislator. And this is how alcohol problems are defined. They're defined as individual problems. And we have this mindset that there are really just 2 things wrong with alcohol. There's alcoholism, which is alcohol dependence, and there's drunk driving. So alcoholism. Well, actually, the problem is not alcoholism, it's binge drinking. That accounts for more than half of adult consumption, at least 2/3 of youth consumption, and 92% of binge drinkers would not qualify for an alcohol dependence diagnosis. Drunk driving only accounts for about 17% of adult deaths, accounts for less than half of the youth deaths. So if we focus on these 2, we miss the bulk of the problem. And yet we have a lot of news about how good alcohol is for you. This gets a lot of coverage, and yet it's not particularly accurate picture of what the research findings actually are at this point. A cardioprotective association between alcohol use and ischemic heart disease cannot be assumed for all drinkers, even at low levels of intake. That's from one of the most recent meta-analyses. And that protective effect depends on a very narrow range of drinking. If you include binge occasions with that, which is the more common pattern of drinking in the US, you lose the benefits. The bottom line, the harms from alcohol far outweigh the benefits, but this isn't news we particularly want to hear. So the problem definition sets up the solutions. If it's defined as an individual problem dependence, then the solutions are treatment and education. If it's defined as drunk driving, then the solutions are drink driving countermeasures, some of which are effective, but many of which will have no influence over other alcohol-related problems. So why do people drink? This isn't fundamentally an issue of education and awareness. Fundamentally, people drink because they can. And the public health approach to this targets the environments that condition on individual choices and the ability to drink in excess. And the public health solutions, and these are the World Health Organization's 3 best buys in the NCD action plan, as well as in the global strategy to reduce harmful use of alcohol. Restrictions on physical availability, things like restricting days and hours of sale, the density of outlets and minimum age laws, price interventions like raising alcohol taxes and putting in place minimum pricing, and marketing restrictions, where statutory restrictions are best. And really the way the French do it is a model. The French banned everything and then included a few exceptions. You're allowed to talk about the qualities of the product in France, but you can't do any lifestyle advertising, and you can't advertise broadcast, cinema, and you can't do anything with sporting events. So who benefits from the current frame? Well, certainly the alcohol companies do. If the problem's defined as an individual problem, then it can't be about the companies or their practices. And if the problem's about drinking driving, it's even better because they can be part of the solution. And they have put together road traffic safety partnerships all around the world where they promote some of the least effective strategies in the name of being part of the solution. The reason they have such a difficulty being part of the solution is because they have a fundamental conflict of interest. CDC, 75% of adult consumption is binge drinking. One study found 37% of the revenues from alcohol come from underage and pathological drinking. It's just really hard for me to imagine a successful CEO skipping into his or her board of directors meeting and saying, let's go lose 37% of our market. And true to form, they consistently and globally oppose the most effective strategies. So the alcohol stories we get, they're single incident or catastrophic event stories. We know from media research that these episodic stories lead to blaming the victim rather than looking at any larger societal or institutional issue. We get the best coverage on alcohol from the business press. The Wall Street Journal for years was the go-to place for in-depth stories about what was happening around alcohol, much better than other areas of the press. And then we get news you can use, that alcohol is good for you, and wine reviews. This is just one example of trying to get a public health voice out. We had a 2-year campaign here in Maryland to raise the alcohol tax for the first time since 1955 for distilled spirits. And we've done a content analysis. There are 3 states campaigns represented here, but I want to call your attention to the Maryland one in the right-hand column. And you can see, even with a major effort, partnering with a lead organizer who understood that public health needed to be front and center, that still, we only managed to have 11% of the stories in Maryland on the tax campaign mention any kind of public health research at all. So the kinds of things I'd love to see asked in alcohol stories: was the person tested for alcohol? Where did they get the alcohol? What kind of alcohol were they drinking? Because at the end of the day, as far as I'm concerned, our public conversation about alcohol is locked into 60 years ago. It's still all about alcohol dependence, and we still function with a funny shadow of prohibition. The media coverage reflects and feeds that public conversation. Alcohol is one of the 4 priorities of the global NCD strategy, and if we're going to change alcohol's role in NCDs, we need to change the alcohol story we're telling. Thank you.
Thank you, David and Bob. I think now if you both come up, and also Joanne and Derek, and we have a few minutes for questions, and then some concluding remarks by Joanne. So far, we're on schedule, and we're covering a lot of ground. So, Derek, maybe we could start. I mean, if you respond, where's Bob? Well, Bob is coming. Okay, there's a missing chair there. Maybe if you could respond to some of what you just heard about the framing from David and Bob.
First, I haven't had a chance to publicly thank Bob for that grant. He had left Rockefeller by the time the meeting happened. So it's 20 years later, but let me tell you, it was the best investment you made. The meeting for the first time brought together African heads of state. I didn't know at the time that now through the tobacco industry documents, we know that the media were organized and paid probably 10 times the amount you gave to disorganize the meeting in preparatory meetings they held with the media across Africa in the months leading up to the meeting and the months following it. And there were two direct outcomes of the meeting. The first was that the team we brought into Zimbabwe then came to South Africa and met the new ANC economic group, built the case around why taxes were important, and in the next few weeks we'll be publishing the result of that 20 years later, one of the fastest continuous declines in tobacco consumption virtually anywhere, based really on the tax and other things. I think the other points I think that you made about food and processed food, I think is something that the framing has been really extremely bizarre often for an educated media to do. The one issue that is never spoken about, particularly in developing countries, is the massive food waste, that post-harvest waste, that can really be solved almost rapidly by minimal processing. If you read the recent Food and Agriculture Organization reports on how you reduced food waste, among their high priority strategies relates to packaging and processing. So throwing everything into the can of, I suppose that's not too bad, of being processed, we often miss the opportunities for canning, freezing, simple measures actually to have enormous potential positive impacts both on the food supply as well as on public health. We also, I think the problem we have is that we often have foodies out there publishing books confusing the public. The latest one is Cooked. Anybody read Cooked by Michael Pollan? Mm-hmm. He wrote some quite good books giving us good advice about eat many plants, eat less food, and avoid meat. Anybody reads Cooked will see he takes us in 100 pages into how to barbecue a pig and focuses on the crackling and the delights of the crackling, then throws a whole lot of salt into a pot as he stews and spends 10 days making bread. Now, I'm unaware of that combination being the ideal menu to eat. And the value of fruit, vegetables, nuts, grains, and fish is not mentioned once in this book by our great guru. Last point I'd make is this issue of, and nobody's going to call him to account because he's regarded by the darling of the media. He's the one who gets called on whenever there's any shift in processed foods or some new effort by a company to move ahead. On the paternalism, libertarianism debate, I think this is a really deep issue, and I really think that it's not going to be easy. I think we are at an interesting point where in the past it was fairly easy in public health to make the case for paternalistic approaches. And I said, particularly since under tobacco they were probably demanded and they probably had a big impact. I think the shift towards away from those approaches is not just driven by industry interest. I think it is driven by a shift in population demand, whether we like it or not. To be more engaged in the decision-making process. And the way we need to approach it, I think, is the way and the attraction why I joined a company building its entire business case on using behavioral economic methods. When I go to schools of public health, I rarely find anybody who studied Daniel Kahneman's work, even though he was the only psychologist to get a Nobel Prize for economics, and has really spearheaded work like Cass Sunstein, who gave us Nudge and gave us the healthy plate as opposed to the healthy pyramid, which will transform diets, or Dan Ariely and people like Brian Wansink, who's starting to talk about mindless eating and choice architecture and changing the environment to actually help us make those healthy choices easy choices, or Kevin Volp, who's pioneered the use of economic and financial incentives to help us overcome our inclination in the short term to always want what's pleasurable, and in that, when we do that, ignore the long-term negative impacts. The incentive is there to get us over that hurdle. And he's shown that you can improve the smoking cessation rates, improve the adherence rates, improved weight control by the appropriate use of different types of incentives and behavioral economics. So I would say that, and why I mention it in this debate is that behavioral economics has been coined by some as libertarian paternalism, taking the best of both worlds, recognizing people's need and desire to have choice, but realizing that we have to steer them away from those choices that are going to push them over the cliff.
Okay, Bob?
I just want to pick up on that last comment that Derek made. I heard yesterday from the vice mayor in New York responsible for water and sanitation that 20 years ago, all New York water was metered by footage on the street. And now they have introduced over the last decade metering not only at the household level, but instead of getting a quarterly water consumption report, you can dial into the website and 4 times a day see what your water consumption. The use of water in a city that has actually had a slight increase in population has gone from 1.9 billion gallons a day to barely 1 billion. So short feedback.
That's over what period of time?
Over about a decade. So short feedback loops, we've got to figure out. I think that's at the heart of Kahneman's work too, is that, you know, when you incentivize people to do the healthy thing, and it's paradoxical that it often deals with chronic disease, but we all naturally discount future benefits, so that's another challenge. Try to get somebody to quit smoking with the promise that they'll have less heart disease 20 years from now. It doesn't mean anything. But quit smoking because you're going to taste your food better in 3 days. That's really helpful.
Oh, the idea of short feedback. I want to turn this to questions from you all just in a second. I wanted to ask David for just on that point on the alcohol stuff. I was really struck by your presentation about, you know, why isn't the media better? Why is the media so susceptible to the framing that we've done on this story? And you lay out very much that's the reality. But what is your thinking as to why? And what are ways to overcome the framing that we traditionally have followed in presenting that issue?
So we're deeply ambivalent about alcohol. And, you know, this continuum we all fall into. Tobacco, all bad. Alcohol, sort of, can be good, can be bad. Food, good. And that can be bad, can be good piece, it's just, we're very ambivalent.
But we've been through Prohibition. I mean, I'm from Winston-Salem, North Carolina, so I know a time when tobacco was good too in Winston-Salem. so I've lived through. I mean, we've seen these changes over time. So why is it today that there is this attitude, and particularly in the media, in the way that the media frames it?
Okay, there's a big difference between alcohol and tobacco in terms of people's personal experience of the problem. And a colleague of mine in tobacco years ago said to me, if we'd been defined as tobaccoism, we never would have made the progress we've made. But alcohol, since the repeal of Prohibition, right after Prohibition, we had the rise of alcoholism as a disease, the whole alcoholism movement. So that at this point, it's really interesting, even folks we run into in the news media who have a personal alcohol story to tell, have a personal alcohol story to tell. And that is the ideology of the recovery community, that this is a personal issue, that no matter what happens, the alcoholic will always get the alcohol. So we don't have a natural sympathetic constituency. It is a myth that the alcoholic will always get the alcohol. Dependent drinkers reduce their drinking almost as much as anybody else in the face of a tax increase, in the face of decreases in alcohol outlet density, and so on. But it's that, you know, it's a very powerful historical frame that we're living with on alcohol.
If I could just add 2 comments. You know, when we were doing the report on mental health at WHO, I think what came through for us was in response to that, there were two big reasons we saw. One was ubiquity. The ubiquity of alcohol, even in the building of WHO, where you still buy alcohol, and it was a painful decision not to serve it to people. It was regarded as extreme. And the second is the link and the problem that it has with mental health, the stigma issue, and just the pure inability to talk about when alcohol becomes a problem, either in the workplace or in the home. And until we're willing to destigmatize mental health more broadly, I think we're going to have difficulty making progress on alcohol, which is on the forefront of many of the mental health issues we should take on.
Okay, questions in the middle.
Hi. So you talked about just increasing regulation. So I know in the drug industry, any kind of branded marketing material has to have fair balance. So any good side effects you have to also list the bad side effects. Do you ever see that happening in the food industry? And if so, would that ever make a difference?
You're suggesting the need to have fair balance as you regulate food. I'm not sure what you're proposing. Or do you want to have, say, regulations against food and then have the food industry respond?
Marketing in the food industry.
Okay. Well, I mean, the one interesting thing which our tobacco colleagues would speak to is that there was this period. I mean, you've got a particular problem in the U.S., or we do, and that's the First Amendment. And remember, the way they got around the First Amendment on getting rid of a lot of the advertising was through the litigation process, because you can't achieve that through the legislative process. But there was, of course, this period when there was the ability to actually have equal time for tobacco advertising. Would be every bit of tobacco advertising had to be matched with the health messages. And what happened? The tobacco industry pretty quickly withdrew from many of the media that were covered because it was so effective. So I think that is an interesting strategy to think about. How would you introduce it? I don't know. I think the point that I heard made by somebody here, I can't remember who it was that the sheer volume of marketing dollars currently is so dwarfed by the public voice and the government voice on the healthy side that it is very difficult. The way we're going about looking at controlling marketing in the food sector is by specific products, specific areas, and that's not the issue. The issue is the total ubiquity of marketing of many of the broad-based categories of unhealthy food compared to the extreme invisibility of the marketing of healthy foods and products. And I think that there are ways of using market forces to start redressing that.
I'll just add on the alcohol side, we'd be thrilled even to have ingredients on the label. Yeah, ingredients, calories. We just got a voluntary serving size label. Voluntary. That's big progress. There is a warning label on alcohol. I don't know if you've seen it. If you have, your eyesight is very good. And it has 4 little dirty words on it at the end that were added in committee on the Hill: may cause health problems, which exempts the industry from product liability suits from 1991 forward.
We had a question over here, I think.
Yeah. Jared Castanedi, Center for Communications Programs. We've heard a lot about traditional media, news media, mass media, and the loss of journalists over the past 13 years. Can you talk a little bit about the rise of social media and citizen journalists?
Joanne, do you want to?
I'm actually going to pass this on because they're a very different group of journalists. For the most part, there are some what we call legacy journalists, and believe me, being called a legacy journalist is a sign that they may be looking to lay you off. So it's not a good thing. It's not a good thing to be a legacy journalist. Some of the legacy journalists have adopted it and have adopted it well. Most, they're forced to by their employers to, put stuff up on the website. At NPR, we all had to sign up for Twitter and Facebook accounts, and the stronger reporters were able to resist, paying attention to that. But most of us had to pay attention to that and start doing that. And it's not part of our natural way of doing things. It's resisted within journalism. But I'd be interested to hear from someone how that's affecting, your various interests.
Well, clearly, the industry is on the foreground of it, and I think it's a double-edged sword. On the one hand, the power of the new technologies is that you can frame, shape, and focus so much more effectively. So you can get messages about, if you're worried about the harmful or the unhealthy products, through to people in a far more accurate way, often at lower costs. But the other side is that creates enormous opportunities of substantially lower costs for the public health message to get out and to actually be doing what happened in tobacco, to run alongside the media stories, the truth in the ways in which we saw the Truth campaign, or Bob, I've Got Cancer, the campaigns run of California on big billboards could be run much more cheaply and much more efficiently on the internet. People often are unaware that one of the earliest NGOs to effectively use the internet and internet services was the tobacco control movement. There was a closed network that eventually became GlobalLink. Thousands of us were part of it and were screened into a network that, without that network, we wouldn't have been able to, I think, drive a lot of the actions that led to the Framework Convention. So I think, on balance, I think the power is being shifted to those who don't need large corporate budgets and those who have powerful ideas and innovative ways of getting through into networks. And I feel very hopeful that that's going to be generally better for health than the very expensive approach we've had now on some of the, particularly the marketing and advertising aspects that we have out there.
We actually have a position in the Center for a Livable Future held by Mike Milley. The title of the position is Digital Assets Manager. And the human resources people at the school spent a long time trying to figure out how to classify him when we told them what we wanted this person to do. So we had a recent, year and a half long effort to document and bring to the surface the fact that organic arsenic has been used in poultry production. It's also used in swine production in the United States. And what had been neglected was the fact that some microbiologists had determined that the organic arsenic, relatively non-toxic to humans, was transformed in the gut of the bird or in the chicken litter on the floor of the hen house into inorganic class 1 carcinogen. So Keith Nachman and Dave Love and collaborators collected chicken samples from around the country, measured the amount of inorganic arsenic in breast meat, challenged the FDA, which had restricted its food safety investigation to arsenic content in chicken livers, and then through a really wonderful science writer at the New York Times, maybe a legacy journalist, and through blogs on our website, and through other social media messaging, we have been pushing, advocating, and the FDA finally removed approval of 3 of the 4 arsenicals that have been used in poultry production in the United States. So the new media is a powerful weapon, but it has to be combined, in my view, with a really carefully thought out advocacy campaign. And if you've got a really outstanding science writer on a major newspaper or for a major media outlet that's kind of laying out the facts of the matter, and then you can refer back to that, link it, Twitter about it, and so forth, it can be part of a coordinated effort to really bring a lot of political pressure on the regulators who need to do the final action.
Just a quick example from our experience at the Pulitzer Center, that we did a project called Roadkill. You'll see it on our site, on traffic deaths and injury from traffic, unsafe conditions on the roads around the world. And we created an interactive map. Dan McCary, our web designer who did the map with the Cancer Project for the World with Joanne, also did this map, and it shows for every country. And then we put it out in August, and it by our standard, it sort of went viral. We're approaching about 500,000. I think we're getting close to 500,000 people downloading that, looking at the map, and you could see in real time how it spread from country to country, and people picked up on it before we did any kind of traditional media. And then we got it featured in the NewsHour, and then it's pending now. We're going to do a big takeout on this in the Washington Post, so that we're building up toward traditional media, but starting with something that already shows that it has legs and reach around the world. And it's something that was done at very low cost internally, and we were using World Health Organization data, and it's been a very effective thing for us. Question back. One more question. Go ahead.
Can I talk about social media for a minute?
Sure, I'm sorry, yeah.
Okay.
But then we're running out.
A completely gratuitous advertisement for my fourth-term course in media advocacy, where we do talk about social media and its role in the news. And I don't know if you've been one of the guys who's been working on the arsenic issue in the media, trained in that course. Anyway, proud graduates. I do think there's huge potential, but I also think there are huge downsides. And you talked about the marketing piece. We've been tracking the amount of alcohol marketing happening in social media. It has absolutely exploded, and the alcohol companies are way ahead of everybody else in terms of their sophistication in using that. So this is an area where we have to learn how to use it. And there is, that's a set of skills. And then Joanne remarked that this is a different set of journalists, and I think this is important to understand. In grassroots organizing, we use the term astroturf for pretend grassroots movements, and we need a term for pretend journalists in social media who master the form but don't have any of the training and principles for how to do what I would call real journalism. So they put up stories that are hack advocacy pieces that then live on the web forever and can do huge damage, as we've seen in the blogosphere, et cetera, to significant movements for progressive change.
Okay, one more question maybe here.
Yeah, sorry. Hi, I'm Catherine Connolly. I had a question going along with sort of the hack advocacy, but also within the food industry, specifically the recent Chipotle ad, the Scarecrow that came out. It's received over 6 million views on YouTube, and it's a 3-minute animation about the negative aspects of corporate food production. And then at the very end, you find out that it's actually an ad for a video game that Chipotle has created and for Chipotle itself. And for me, this is really a difficult issue because I love the animation. It's a beautiful story. I think it's portrayed really well. It's clearly directed towards children and towards our heartstrings. And Chipotle has been making some steps towards better practices, but at the same time, it's a massive corporation with lots of public health issues. And so my question is, do you see these sort of initiatives as a small step in the right direction coming from within the corporations, or is this more along the lines of, say, the alcohol companies that portray themselves as being part of the solution when actually being part of the problem?
Great question. And I think, there was a time when Chipotle was wholly owned by McDonald's. And so this is already a spin-off. I think the way we got trained in public health is to go back to my first comments, is to think about good, bad, or it's dangerous or it's not dangerous. We don't do very well in the gray zone. We don't do very well in understanding, as people like B.J. Fogg, one of our great behavioral designers from Stanford, remind us that it's the baby steps that matter, provided there's environmental change going along with the baby steps. And I think we don't have the metrics to really see whether a shift in food companies, say like Chipotle or the Chicken Mac wrap or any of the new inventions or interventions, are a step along an inevitable long-term improvement in the food supply. Because if that is the case, they've got the scale to really bring about fundamental and very large-scale changes. We should be getting behind it. But we're starting now to see people look at the metrics. The Access to Nutrition Index is worthwhile looking at, endorsed by a number of the investors, funded by the Gates and Wellcome Trust. It's starting to track the leading food companies in terms of independent ways of verifying whether these nutrient changes are making progress. 15 or 20 companies have made pledges around salt, sugar, fat worldwide. They now have to actually provide the verifiable data from independent sources if they're doing it. My view is as they start giving data that can be verified, the public health community can't sit on their hands anymore and say, well, we're going to wait until they get right to the end of the day. They need to start giving some praise to actually keep the journey moving along in an incremental way. I think that there are groups of companies that are making these changes, even though they may even be painful in the short term. Inevitably, the pressure is going to come from the large-scale investor and consumer sector. And there we're seeing big demands. We're seeing the demands of investors to put sustainability criteria way up alongside their financial ways they evaluate what to buy and what to sell. Consumers want important information not just on the healthfulness of their product, but on the environmental sustainability of their products. And I think all of those trends mean that we are going to start seeing these steps hopefully start accelerating.
Well, I would just like to add that if you like the scarecrow, you'd love the matrix. Google Matrix. It came out about 3 years ago from the Global Resource Action Center for the Environment. Terrific graphics, and it built off the matrix. One of the really interesting things that happened with the menu board labeling that was pushed through by the Bloomberg administration was really what I think Derek is alluding to, that you can create situations in which the manufacturers begin to respond ahead of the curve, ahead of the public health message. And it was, in fact, the threat of having to post the caloric content of their various offerings that stimulated tremendous menu restructuring on the part of some of the chain food restaurants. And they ended up with much healthier, lower calorie, lower saturated fat offerings, not because consumers were demanding it, but because there was a new bar that had been established. So if negotiating in advance, and I had this conversation with the CEO of Chipotle, I kept asking him, why is your portion size so big? You're doing all these other good things, the ingredients, sourcing of your materials, quality products. Why are you still committing that cardinal problem that's a big issue of food waste in the United States and certainly of excess caloric intake, portion size? He said, I'd be killed in the marketplace if I didn't match my competitors. So it's a complicated set of issues, but I think there is real progress being made as some of these manufacturers begin to appreciate the health and environmental benefit of making a better product.
Okay, well, thank you all. I mean, we want to turn now to Joanne, who's going to give us her thoughts on what we've heard today and lessons particularly for academics and practitioners in public health in dealing with the media. So, Joanne, if you could do that, and then we'll come back and we'll wrap things up. Thank you.
Great. I'm going to cut this down a little bit because we're slightly over time, so I'll be talking fast, and I'm going to talk about three things, three ways of media involvement, or three ways of getting your information out to the public. One is when the media contact you. The other is second is when you contact the media, and the third is if you decide to go it alone. And that's actually something that these days I'm encouraging. So the first thing I want you to do, this is a little, can you all read this all the way in the back? Yeah, this is an article that came out in the New York Times, and not sure how long ago, a couple of years ago. Can I go on to the next page? And there was something that came in between here that was irrelevant. Does anybody need to be told what's wrong with this article? Because if you do, we can talk afterwards. But I think it's a public health school. We all know there's about 100 mistakes in here. And the group that she was talking to, Malaria No More, put out an announcement the next day on their website detailing what was wrong and how she had misunderstood what they were saying. What does this mean to you guys? Well, if you take it at face value, I mean, first of all, it would be not to talk to this particular reporter, but why talk to any reporter? If they're going to blow something, the danger of the story is that people are going to stop being interested in all the efforts to end malaria, that donations will stop and that public pressure will stop, because malaria's gone. Why bother? You know, this is a dangerous, dangerous piece, and you don't want to be involved with something like this. What I'm going to say to you, though, is it might be a little counterintuitive. You need to talk to reporters like this because they need to be educated. She clearly didn't understand. She clearly walked out the door after the interview at the organization and didn't understand. So I'm going to put in a plea for one to talk to people like this. Here's what, and there's a way to deal with him. Tony Fauci in the first days of AIDS, if you called him up, which I did constantly because I was a reporter back then, if he didn't know you, he would say to you, listen, I will talk to you on the record if you give me 5 minutes off the record. And it was Tony Fauci, so you did. And what he would do in that 5 minutes is say, here's the situation, here's the data that have come out today, or here's what we know now. And he would explain it to you, and he'd say, now you can go look for your quotes. Now interview me, and that's fine. And you would understand. And sometimes I completely changed the interview based on what we had done in the pre-interview. So that's one thing that you can do. But you should always know who you're talking to. You need to know about that. You've got a great public affairs group here at the university. It's traditionally one of the best in the country. If somebody calls you, you might want to call your public affairs people and say, do you know these people? And I can tell you that, and then you can get a little feed. It might be, you know, that reporter has had, you know, confusion about this issue you might need to explain, or that reporter is very good, or, you know, whatever it is, I think your public affairs people can help you. I would never talk to anybody without Googling them and seeing the last few things they had done. That's for sure. One of the reasons you need to talk to, you need to know who you're talking to is something that happened to me when I was a media official here, which is I did put the net wasn't around, research was a little harder. I got a call from a reporter from Toronto. I could tell from the area code. And he said he was from the Globe. The Toronto Globe and Mail I knew was one of the greatest papers. It's one of the greatest papers in the world. So I very happily put this guy in touch with one of the researchers, only to find out that it was not the Toronto Globe and Mail. It was the Globe. So know who you're talking to, and if you know, again, talk to your media department. And when you do talk to somebody, here are the kind of things that we need to know to get things right. One of the things I need to know is that when I was doing a lot of daily news reporting, I need to know about things in advance. Reporters get the Journal of the American Medical Association, New England Journal, legacy reporters. I don't know that bloggers do, but we get those journals 3 or 4 days ahead of time, and we can take a look, excuse me, and see what we're going to do and interview people ahead of time. So knowing ahead of time is great. I need to know if and when I can get back to you after I've spoken to you. I think one of the reasons that I'm guessing, I could be completely wrong, but maybe with that article, she called somebody. They did the interview. The person, she had more follow-up questions. The person wasn't around. I mean, I went through a stage where everyone I interviewed went to Europe. It was a great way to get to get out of the town. Was I would interview you and then you would disappear, and that's terrible. If you're not going to be around, tell them during the interview. You know what? This is your only chance. People need to know that. I need to know what numbers, and I need to understand numbers because numbers are incredibly powerful. And I was thinking with the tobacco talk with the alcohol talk, some of those numbers were somewhat new to me, and putting numbers together in a really interesting way can really make it. Now, you have those numbers, and I still can't explain. I was very glad no one asked me to explain the media role in that because, excuse me, I don't know because you had the numbers, but make sure before the reporter gets off the phone with you or gets out of the interview that they understand the numbers. Look for a single number or a simple image, a metaphor. Have a metaphor involved before somebody talks to you. And so this, I'm sorry, I meant to do this. This is what I need. I need to know things in advance. I need to know if and when I can get back to you. I need numbers. And this is an example. This was another graphic for that graphic you saw before. People understand graphs and charts, and right now there's a big effort to generate your own on the media side. But if you've got one, that is great. What I don't need I don't need to show you my work before it appears, although some people, it's becoming more and more of a trend. When I got out of journalism school, they take away your degree if you did that. You can ask, but don't be surprised if the reporter says no. If the reporter says no, you can say, how about if at the end of the conversation you read back to me the quotes you're thinking of using? You can do things like that. And you can also say that you'll be available. I don't need to hear at the end of the conversation that something's off the record. This has happened to me on deadline, and it's not good. If you want to talk about off the record or on the record, make it clear beforehand and define. For some reporters, they'll take an off the record to mean I can't use your name, but then they'll describe you as a high-ranking official and everyone will know who you are. So make sure whatever your off the record definition is, do you not want your name used, but the thought can be used? Do you not want it attributed to any person? Make sure the reporter understands that. Okay, so I've been doing a lot of whining. I've been doing whining about the current state of journalism. I'm going to tell you that there's an upside in all this for you. That the numbers that we've talked about the disappearance of the major media, there's still a hunger for information. A smaller group of people, but they're more interested because they're seeking it. And there's room for you. There are blogs. It's a brave new world. And I encourage you to get involved. This is a perspective article written in the New England Journal of Medicine from somebody who I did several stories on, and I was in Haiti after the earthquake. She was a surgeon. She was very interested as well, and she had all these thoughts, and she said to me, you know, I'd love to have this come out somewhere. So I talked her into writing something for the New England Journal of Medicine. Now, her first draft was 3 times as long as the New England Journal takes. I talked her into cutting it down by a third, and it got in. Those are the kind of things you can do. If there's if you've got a journal club, maybe you've got 3 minutes at the end and talk about putting things on the web and figure out, you know, some things you're going to need to get help for. Most of you people aren't English majors, I'm presuming, and you know maybe aren't that experienced. You can usually find somebody somewhere in your public affairs office or somewhere to help you with this, and there are lots of places to go. Let's see. This was an article in. This one I think I'll just skip. I was just going to show you what your competition is. The Guardian, which is one of the best papers for global health issues, ran a great story on sanitation, very important. But look at the competition they had. More from the Guardian. Madonna, I was raped at knife point. You know, this is, you're going to have some competition if you get into this world. It can be ugly, but it may be worth a try. Let's see if I do it that way. Go back to what? Thank you. Great. So that's a little bit more in the competition. Oh, I did it again. I love that web. Let's go to here. Our competition. Okay, opportunities. And if anybody wants to send me an email, do it. These are places that take reporting from the field. Humanispheres is a great blog that comes out of Seattle. A terrific reporter I don't always agree with, but he's always interesting. Scientists at Work. I'd love to have time to show you this, but I'm going to trust that those of you who are interested. These are dispatches from people doing research, and they take stuff. Now, you know, when I say they take stuff, it doesn't mean they take 100 out of 100. You might send them stuff for years before they take it. You have to have the heart for this if you're going to start with it. But it's, you know, you can get your word out, and you can get things from the field where things are really happening. Seattle Globalist, you know, you'll notice a lot of these are Seattle-based. Globalpost.com, they take dispatches. If you go to their sites and you look around, you can usually see where they're coming from. And my last word on this is that the first word in public health is public. You guys are doing really important things, and it's been breaking my heart to see how few things get out there in the media. I finally, I don't know whether you remember in the cancer story I showed you a guy, Corey Casper from the Hutch, who I have finally convinced after 2 years, I've convinced him to start blogging. He's got a great blog, and you know, so you know, maybe 40 people will read it, maybe 100 people will read it. Who knows? You know, things can go viral. But it's a way to get the word out about what you're doing in a way that the public really needs to know about. So I know this was short, but I hope it was encouraging. You've also got a public affairs office. You can probably talk to those folks about it. And again, first word in public health is public. It's your responsibility to be out there talking. Thanks.
Thank you, Joanne, and thank you to all the speakers. This has been a really rich conversation all afternoon, and thank you for the questions and for all of you being here. The two things that I take away from this that really stuck with me were the points made about framing and about discourse, and I think this is so important to us in the media to understand that there are alternative ways to frame these issues that can engage the public in a different way and not fall back on the same tropes that we tend to rely on, the sort of stale stereotypes and caricatures. And the other is discourse, and that's very much at the heart of what we're trying to do at the Pulitzer Center, the sense of sustained engagement, and from commissioning stories year in and year out on these big systemic issues to keep them in the public domain, in the media, and then looking for opportunities like today or like the partnerships we have with universities around the country and with our high school program to use the journalists, people like Joanne who've done such great work, to get them to go out and talk about it and reach new audiences and help us to learn from the audiences that we meet with and how to do our jobs better. So we're grateful to all of you. I want to thank Brian Simpson from Bloomberg, and I want to thank all of your colleagues here and Dick Thompson for coming. Dick sort of came and volunteered at the point of one of his many jobs he's had, and he'd heard about us, and he said he wanted to help us think about, could he be of use to us, and he's been terrific in helping us to find good health journalists and shape stories, and we're grateful to you for that. And I especially want to thank my colleague Peter Sawyer, who's the director of our health reporting projects, and he came to Bloomberg. He pushed for this partnership beginning a year ago. He made it happen, working with Brian and others here. He has been our main person dealing with the Gates Foundation and other funders to make our health reporting possible, and he very much organized this conference while I was off in the Congo the last 2 weeks. So I'm just sort of mouthing his words as I stand here, and I'm grateful to him for all the help. So we're going to have a reception just to the left outside, and I hope you'll all stay and continue this conversation, and we look forward to doing many more of these in the future. Thank you.